gather around, please. We are already behind schedule. All right, folks, we're going to get back together here. We have quorum to begin.
Just call anyway.
I'm going to call on Ms. Tolan.
All right, we need to certify our closed meeting that we had today. In order to comply with Section 2.23712D of the Code of Virginia, it is necessary for the board to certify that since the Fairfax County School Board convened a closed meeting on October 19th, 2021, to the best of each member's knowledge, only public business matters lawfully exempted from open meeting requirements, and only such public business matters as were identified in the motion convening the closed meeting were heard, discussed, or considered by the board during the closed meeting. Do I have a motion? Moved by Laura Jane Cohen and seconded by Karen Corbett Sanders. All those that agree? That's Ricardo Anderson, Laura Jane Cohen, Megan McLaughlin, Racha Seismer-Heiser, Karen Keys-Gamara, Stella Pekarsky, Tammy Koufax, Elaine Toland, Karen Corbett Sanders, and Melanie Marin. Thank you.
Okay, that's the majority. All right, we'll go ahead and resume the discussion. Staff completed their presentation of the operational instructional update. We will go ahead with board members. So if folks will put up their placards, I did have the previous order, so we can start there. Okay, Ms. Corbett Sanders.
My last question is purely operational, is regarding the privacy of the student data and the staff data, both in the testing environment as well as in the surveys that we do of the community. What are we doing to protect personal identification and privacy?
With respect to the testing data, only persons who have the identified level of access will have information regarding student testing. At this time, that's identified to be the principal, the assistant principals, and the health point of contact at the school. And those are the persons that currently work our red cap process and help to work in identifying potential close contacts of a positive case. So we are keeping that net small, but we do need to have those persons to be able to respond and provide those appropriate next steps.
No, I appreciate that, but we have a contract with LTS who is going to have access to personal data. Can somebody please assure me as a board member and the public that we are putting in the appropriate safeguards for student privacy and personal identity?
Yes, we do have language, and I'm not sure if, I know Mr. Smith had to step out, and I'll provide the high-level language, but we do have a language incorporated into the contract regarding confidentiality of student information, HIPAA protected, all the health information. And there are those safeguards. Our IT department is working closely with the vendor to make sure that the portal is safe and secure as well.
So if I could just have assurances that in our communication with families, we explicitly address personal identifiable data and how it will be protected. I know that this is a major concern for people in general, but especially when it comes to things like this. Thank you.
Thank you.
Next, we had Ms. McLaughlin. Go later. Okay. Dr. Anderson?
Thank you. I don't think anywhere in the presentation I saw the cost of the vendor.
So there is a minimum that the vendor has to bring in per team on average per site per day. They do have the ability to bill insurances and also a federal grants program. If that daily minimum is not met, then FCPS will be responsible for that cost, and I'll pull that number up for you in one moment.
Okay, thank you. And also, I imagine we are going to be utilizing ESSER funds with this, for this expenditure.
Lee Burden would have to speak to if there were any, or the finance team, if those costs weren't covered, but there are some expenses related to implementation. I mentioned the COVID point of contact that the team identified funds for schools, and schools may be utilizing some of those ESSER funds to have that point of contact person at the school-based level. Remember, we talked about certain responsibilities at the school-based level, so supervising students as developmentally appropriate, identifying kids and where to go, that type of thing. So those positions are able to be supported with ESSER funds if the school identified that as a need that they have at their specific building. But I would have to have our finance team to speak to if that daily minimum was not met, what specific budget allocations would be utilized to support that effort.
Yes, Dr. Brabrand, I think that would be an important piece of information to have.
Yeah, we can get you that information. We do expect overall that the costs around associated with the vendor are going to be minimal, but we can provide that information and an update to the board moving forward.
Okay, thank you. Dr. Boyd, I appreciate what you shared were going to be the expectations regarding athletes, but one of the things that I noticed, it's not in the presentation itself, it was one of your talking points. Are we going to be providing that in writing to parents once they're invited to have their athletes participate in the testing, so that it's clear if you do not test and you're not vaccinated, you do not play?
Yes, we will be making sure that's clear. We have some of that information already out. It's on the website and the athletic information, but we'll be sending out additional information both later this week and next week to make sure that everybody is clear on what the expectations are, how the testing is going to proceed, and that if you're 18 and over and you don't have a medical exemption, or you don't
15 and over.
if you're 16 and older and you don't have a medical exemption or a religious exemption, then you will not be able to participate.
Okay. So even our students with a religious exemption will not be tested?
If they have a religious exemption or a medical exemption, they will be tested once a week. Yes.
Okay, I got confused there, but I'll follow
Yeah,
up
they
with
will,
you in a
they
little bit.
will, if they have a religious or medical exemption, they will be tested weekly.
Right, okay.
So
Thank
they
you.
will have that weekly test to make sure that they don't have COVID, so that we're not having teams of 40 or 100 like we had at the beginning of the year be paused in our schools. So that's the piece of the process we have for the testing. And now our vendor's going to allow us to do this just in time for the winter season that begins here in early November.
So there's no recourse. If you're not vaccinated, you need to be tested. If you're not tested, you cannot participate.
That's correct.
Okay, my last question, and I may have misunderstood this, Dr. Boyd. You were talking about the number of students who would be tested at the schools. Did I hear you say that the numbers would be consistent from high schools and middle schools? I missed something.
Oh, no worries. So right now, because we don't have a requirement to have students to submit vaccination data, we are using the county average for student age groups to estimate or to approximate the number of students that we anticipate testing at each site. So we're using our Fairfax County Health Department data for respective ages for our middle school students to make an assumption, a planning assumption, about how many students would be unvaccinated and need to be tested. So that's how we derived that estimated number for students and student athletes, because we don't have that formal data, which is different than the HR realm with staff, and that they do have that concrete specific data for FCPS employees.
I see, but we can expect that if a middle school, for example, Glasgow with 1,900 kids, you'll be sending out more invitations for those kids to participate in the testing than maybe Holmes or Poe.
Yes, we're going to send the information out to all families. And certainly that, again, based on the number of persons that are vaccinated and that second prong of parental consent, as parental consent is going to drive who we're actually able to test once we funnel down to what's the bucket of students that are not vaccinated, and then within that bucket, how many parents have given us parental consent for which we can do our sampling from.
Okay, thank you.
Okay, I see Ms. McLaughlin is ready to go.
So one of the things I had said earlier, and I was just getting ready to send this to the superintendent and the board, is on the Massachusetts Department of Elementary and Secondary Education, they have extensive details about their COVID testing program. They talk about their diagnostic testing and then their routine COVID pooled testing. Under diagnostic testing, it's the symptomatic testing, and then they also do then the test to stay. And that's for the students where you can go ahead and stay in school if you've been, exposed to another student for a close contact, but you're testing every single day for 5 days. And then I think it says something like 7 days. But my point is that, interestingly enough, the state of Massachusetts and also New Jersey at the state level was paying to do this kind of testing. So then that leaves the school districts to use their COVID ESSER funds to do all the other things. And instead, I didn't see the price tag, and I apologize, but that we're now peeling off our money to do this.
So thank you. And I'm going to address the cost question because I found my notes or pulled those notes up. So the minimum amount or average amount that is going to need to be brought in through reimbursement either from insurance or federal grant programs per team on average per day is $4,450. And again, that's from the health insurance reimbursement or federal program reimbursement to LTS. If that balance or that minimum is not met, FCPS would be responsible for the balance of that testing. To address Ms. McLaughlin's question, there is a state testing program, and the acronym is VISTA. Don't ask me what VISTA means right now. I can pull it up, but it's VISTA for short. And we did explore that option, and we may still be doing some level of partnership with VISTA, whereby there's no cost to school divisions. They do provide resources or funds to school divisions to hire persons if you need to, based on your size, to support the program. But we really wanted to look at our capacity. What we know now is that we have positions now that we're unable to fill because there's not the human capital available in the market. We talked about strained capacity as it relates to COVID, and as we look around the community, there's hiring signs everywhere you look, left, right, up, down. So while we may have funds through that state testing program to hire personnel, we were fearful that we would not be able to hire those persons and that the heavy lift would fall to our school-based staff, who we really want to be able to focus on teaching and learning, and our administrators to be able to support staff with teaching and learning. So there is a state program available. We did explore it, but we wanted to bring this vendor in that can do the yeoman's work, even with still some things for our staff to do, but we really wanted to minimize the impact on schools. And we really had that level of commitment and still desire to do that. Again, we're still exploring some other options for some of our unique programs that we may be able to have some additional partnerships with the state-provided program that are a little bit more unique, some of our non-traditional programs that have some different unique needs. But by and large, we identified this vendor to ensure that our staff had the minimal level of work possible as we
No,
implement this
I'm
program.
1,000% with you that this is not for FCPS school-based staff. But in Massachusetts, it's a state single contract with the test provider, CIC Health. So the point is, does the VISTA program have the test provider? And so that doesn't fall on our people.
Yes, they do have providers, but the provider is not on site. Generally speaking, it's students would self-administer the test, and we would ship the testing specimens off and get feedback, get results back. So there would be an additional workload through that mechanism. And again, we could hire people, or we could get money to hire people, but all of the people to support the program aren't provided. You get the funds, but don't necessarily get the body to go with it in some instances.
So
So
now that we've added all these new school nurses, I guess there's just too much to talk about in this one work session, and I've got 19 seconds left. So my big push, Dr. Brabrand, again, is let's take the breaking news from the CDC. Let's really, really look at what we can do with test to stay. You know, we just can't afford to wait, because our elementary school kids are not going to be fully vaxxed until after the winter break. And that's a lot of lost learning in between there.
Yes, if I could just make a comment, we're certainly going to look at test to stay. It's breaking news. We've always been told by the health department that they'll follow the CDC guidance. I want to be clear. This board made it clear to do everything we could to return kids safely and use all the mitigation strategies. This is something we looked at. We needed a turnkey solution with limited impact to school operations that are already strained. Vista is still matching up vendors. There are districts that have wanted to have it since July that haven't had vendors placed. I'm not criticizing, but we needed to have something ready to implement and ready to do it now. And so we'll continue to work with Vista. I think we are still exploring some relationships with them to give us access to actual COVID tests that we may be able to share with families. But we are glad here in October, as promised, as delivered, a full comprehensive regional plan for immunizations and for testing in our schools. And I'm proud of the work that this team has done to bring us to this moment.
Point of clarification, I'm sorry.
Go ahead.
$4,450 per site? Per
team, and each team can cover up to 2 sites per day.
And we're doing this every day. So I just ran the numbers. Am I correct that that's, if we do the 190 schools, it's $845,500?
So dependent upon, each site won't be served each day. So each site would be tested, students will be tested weekly, and dependent upon the number of students who are in that not fully vaccinated pool who also have parental consent would determine how long or the number of days that a vendor would have to be there. But again, the insurance reimbursements through either private insurance or through the federal programs, it's anticipated that there would be minimal cost to the organization, but we do have that information in the contract so that we would know what our obligations would be at the onset if those reimbursements were not the equivalent on average of the $44.50 per team.
So
Okay,
that's the
colleagues, we're
outstanding.
gonna have
Thank you.
to, sorry. Okay, it was Ms. Cohen's turn next.
I'll piggyback on that. How are we going to ensure then that every minimum is met every day?
So we're going to be receiving reports based on the tests that are provided and receiving, our students in our general population are receiving PCR. Those targets because of the volume of testing that we're doing, not only for staff, but for student athletes and our student population overall. So we have a number of persons with our 3 stakeholder groups that will be engaging in this testing.
So, Dr. Brabrand, how will the board be informed in a quick way that we are or aren't meeting it? And what's the pivot then if we're not meeting it and we're finding that this costs a bunch of money? What's the pivot then for how we figure out if this is workable or not?
Well, first of all, I'd say we're here with a safe plan, a comprehensive plan to address COVID in our schools. We have ESSER funds if we need to. We'll apprise the board if we don't meet the mark. This board asked us to bring a plan at scale for 180,000 kids. Massachusetts has had one approach, state-led. This has been led by individual districts. And we're doing the best we can to meet the deadlines as the board asked for. I'm very confident that if we don't see the targets met, we'll certainly update you weekly. I update you already weekly on a variety of operational issues, and we can decide. But for me and for this community to have the additional mitigation strategy of testing for our staff, for our student athletes, for our students, is absolutely the right thing to do. And again, if we find that there's operational challenges. I also just want to say, I think Dr. Boyd said it, but I want to be clear. In the contract and even in the CDC guidance, if COVID transmission goes to low, we have plans to stop the testing assessment. It's not a CDC recommendation. We're currently in substantial. We were in high. If it goes to moderate, we would continue with a testing program. But if the mass vaccination campaign we just shared with you is successful over the next 2 months, and we see our COVID transmissions in the community go to low, this is something we would put on pause and only return to if we saw transmission tick back up. Dr. Boyd, I don't know if you would add or clarify anything I said there.
Yes, and just as a point of clarification, because I know we talked about 3 different stakeholder groups, and so that caveat that Dr. Brabrand shared, again, in accordance with CDC guidance, is applicable to our student body population. For our staff and for our student athletes, they would continue to be tested at all levels of community transmission. So Dr. Brabrand is exactly right.
Thanks for that clarification, right, for our students, yes.
No, I mean, look, I'm not going to argue with you about that this board asked for testing. I think Ms. Darren Kovacs from the jump has been asking for us to do this now for 1.5 years. So I'm not arguing that with you, but I'm saying if worst case scenario is potentially $1 million a day, that ESSER 3 money is going to be gone real quick and all of the beautiful plans we have for it. So I just want us to be really tight about if we're not meeting the benchmarks, then why are we not and how do we nip that quick? All right, the next one is how is this information going to be communicated to coaches that these kids are ineligible to play if they won't get tested?
So that'll be through the Director of Student Activities and through the coach. Obviously, we want to respect individuals' privacy with that, but basically they're going to know that if they're not vaccinated, if they're 16 and older and they're not vaccinated, and they do not have a medical exemption or a religious exemption, that they're not going to be permitted to try out. So there will be a list of those students that are eligible that'll be created. And if you're not on that list, if you don't have the appropriate documentation, then you're not going to be able to try out. So coaches will be made aware of that. All DSAs, assistant DSAs know that, and principals. We have a follow-up campaign of making sure that we're communicating directly with principals and DSAs over the next 2 weeks to make sure that, we just found out the number of teams we'd have assigned to us at the high school level, so we're developing those schedules and making sure that the communication would be very clear. We have updated the website as changes have occurred to make sure that all that relevant information is there, and principals, I know, will be sending out information through the different teams.
All right, I think we'll definitely need some serious region communication help in making sure that that goes through. Another question is there a non-online way to register for the testing?
Yes, there will be support for families who need the paper pencil mechanism, and various providers from the organization that will be able to help folks who still want to do it online but have some challenges navigating the system. So a number of supports for folks.
Thank you. My last question is about personal leave. Dr. Brabrand, you said that we were currently experiencing operational difficulties. I've had a few teachers reach out that said they're being asked to provide reasons for taking personal leave, and I wondered if you would take the opportunity to address that.
I would have to, I'm going to defer to Mr. McDonald on that, and I have to get specifics. I mean, we certainly have a regulation around personal leave, and I'll defer to Mr. McDonald on specifics.
Sure. So our current regulation for individuals that are requesting personal leave does require that they consult with their supervisor for permission. to take that leave. That has been a policy that was in place prior to COVID and is continued through the pandemic. Ultimately, folks that have personal or family-related sick leave requests, those do not require that prior authorization.
And do we know if all of our schools, is this something that's happened consistently? Because I think if teachers have a sense that every school this is happening, then it feels much less personal, no pun intended, that their manager is asking for reasons.
Well, one thing I would say is one of the realities that we're facing is, just like everything in this pandemic, the impacts of COVID have not been the same across our school system, nor are the operational impacts exactly the same at every school. Some principals have had to use this regulation because personal leave puts us over the tipping point. And as I shared with this group earlier today, we have not closed a single school. I can't promise that, but it's a goal that we have every day with the deputy superintendent and the region assistant superintendents to do whatever it takes to have people cover. So we're going to keep trying to do that. Asking people and following the personnel reg where sometimes we just can't, I just can't have you do it, is part of the conversation that we need to have. And as I mentioned earlier, we are pulling a work team together. As you may know, some neighboring school systems have already, because of staffing shortages, shared that advanced days on the calendar coming up, they're not going to be able to operate normally. I don't want that to happen. It is still a possibility, and I have to be, you've always told me to be honest and transparent that we're looking and brainstorming ideas, and it's not it will be one of the last things we would do, but it is something that we're monitoring very carefully, and we'll continue to bring you updates. And personal leave and saying, hey, we're just not in a place to do it is a strategy to say, hey, we need to reduce demand. Especially we're finding Fridays is the worst day for personal leave. It just is. I'll just say too, over the years, and this is the hardest thing, it's a culture in FCPS, which we've talked about, is we've always wanted as a caring culture, give leave, hey, I gotta go. But even when I was principal 15 years ago, the Wednesday before Thanksgiving, I would say at the faculty meeting in November, guys, I know every one of us wants to take off that 2.5 hour early closing on Thanksgiving, but we can't. I just can't. I need, if you've got a wedding, something that's a once in a lifetime, come talk, but I can't just do a blanket. And people understood, and I know in COVID, I just ask everybody for that same understanding. We do care about everybody, but we also need to try to balance that with caring for our kids and our other colleagues who are there left to do their job and cover for their colleagues when they're out. I don't know, Dr. Ivy, did you want to say something else to that?
I was just going to say that's why we haven't done a mandate across the system, because the needs are different in different schools. And we decided to monitor it a little more carefully. But at some schools, if there's a real need and there's a lot of substitute, we've had to put some other substitute requests. We've had to, put some additional things in place. But we continue to monitor.
I think just from a communication to family standpoint, that we probably need to get that message out maybe a little bit more even, and getting out the message, like we have the benefit every once in a while of seeing, the 2 EDs or executive principals from a region subbing into a classroom or doing lunch or whatever, but I think maybe more of that as best we can out to the community, just to let folks know how dire the situation is.
Understood. Will do. Thanks.
And if I could just add, it's not just executive principals, it's central office folks from across all departments and members of the leadership team that are going out and supporting schools to the very best we can. And our retired administrators and other retired folks, we're tapping on anyone we can, but there's still a significant need that we are going to have to address in some way. We're just further, but if it doesn't improve, and that's why, we're continuing to monitor, and we have the group that's going to look at other possibilities.
All right, Ms. Marin.
Yeah, thanks. Regarding the testing, this is similar to the question I asked earlier about any forthcoming, advocacy to the state around mandating COVID-19 vaccinations as a qualification for school entry. That's a hammer for something that we hope that people would do on their own inclination. Similarly, I'm seeing this number about testing 3,000 staff who have not submitted documentation of being fully vaccinated. That amount is the same as a quarter of the amount of students you're projecting to test weekly, okay? About 12,000 students, 3,000 staff. That is a drain on our ESSER funds, on our staff's time. And then when are they doing that? Are they doing that during student instruction or something else? I wanted to know more about the funding. I did look up into our August 26th meeting where we did approve the ESSER funding plan. We have allocated $1.4 million for the mitigation and prevention strategies. So when we're talking about this $800,000 number, it's good to have that context. I wouldn't want us to go over that. And, I'm just, again, wondering what other, I was reading and I even just shared with you about, religious exemption and the discussion around that. But we have 3,000 people that we're going to test every week and spend our very limited resources and time and money. I am not okay with that.
So a couple of things I'd want to share. One, we're working with the vendor when the testing begins, that in those, for the, certainly the initial period, when you go to test each week, you'll have the opportunity to be vaccinated. You're tired of coming every week? And by the way, we're going to be absolutely clear with our staff, we're a caring culture, but to care for your colleagues, you are going to need to submit to weekly testing. If you don't, then there will be progressive discipline that we'll be using with employees in a caring way, but in a firm way, that we are going to test our unvaccinated staff. The other thing I just want to share is while that number seems large at 3,000, they do represent some of our employees who are on an hourly basis, and Sean, Mr. McDonald, you can back me up, where we have kept people who've worked with us over the last year and a half so that we don't have to reprocess them in the system. So some of them actually aren't working every day or even every week right now, but they're in our system in the pool. That's some of the reasons we think they haven't really responded, because they haven't been doing much. But as they come on to work, they'll be required to do that weekly testing. So that 3,000 number may end up actually shrinking substantially in the first month. And of course, like everything else we've done, we will continue to be transparent and update you all on all of this work, on all this planning that we have done. But I share that. And as far as the mandate for staff, I do have the understanding, I heard a little bit from the Virginia Department of Health earlier this week, that there is some revision that's been done to the Virginia Code that lets the Virginia Board of Health, and I'm not the expert, we'll see if Michael Malloy, perhaps Thursday at his update on legislative matters, that the Virginia Department of Health or a Board of Health may be able to each year make recommendations for vaccines of any kind, and we'll just have to explore where that goes. Of course, we'll follow state guidance as we already do for vaccinations, and as I've shared with this board before, I firmly believe that we ultimately need to be in FCPS and in the Commonwealth of Virginia having vaccination requirements for our students and staff if we're going to move decisively out of this pandemic. So, thank you.
Thank you. And Ms. Madeja, I believe the clock was still running while Dr. Brabrand was speaking. I think it was more around like 40 seconds, I think. Thank you so much. My other question is about the projects administrator position. And so, as the person who proposed this motion, I was envisioning this to have more of a public health bent. And I'm concerned that the area of expertise is in social work, psychology, or education. And none of these are large-scale systemic credentials that show the capability to operationalize public health work, which is what I believe the office has been doing. So I think a more appropriate credential would be communications, data analysis, public policy, public health. That's really what I had in mind, or even business management. We need this to be an operational position, and I think we do ourselves a disservice when we think that educators, in their skill in the classroom transfers to a wholly different set of work managing a gigantic system. I also think having a PhD is an unnecessary requirement. We've talked about this in other staffing needs with HR, especially in communications. People don't get PhDs in communications. So I'd love to hear your thoughts on that, please.
You were right on 45 seconds. Thank you.
So I'll start, and then Dr. Boyd may want to weigh in a little bit as well. So when we worked on building this job description, we did consult with Dr. Boyd very directly That's what we believe the intent was all along, to really find out what the needs were for the work and how that work could be accomplished. I appreciate the feedback around some of the other potential areas for degree or experience to possibly fold into this job description. I've taken some notes, and ultimately I can confer with Dr. Boyd after the meeting today to see if there's an opportunity to update. Particularly, or pertaining to rather, the doctoral degree, that is listed as a preferred qualification, and so ultimately that would not screen people out initially in our process, but perhaps maybe used as an opportunity later in the process to pare down the number of applicants for the interview process. Ultimately, that will be a decision left to Dr. Boyd once we get our initial slate of candidates. But the minimum requirements are what we would use in HR to screen candidates when they're coming in.
Thank you, Sean. And just to add some additional context, we do know that we wanted to be able to have this person to come and do much of the health-related work that I've been doing, so I can pay greater attention and spend more time with the special education and instructional components. And while we partner with the health department for the provision of our medical services, if we had someone who solely had a medical background, that would narrow the scope of which they could provide assistance. And while some of the information hasn't just been because, right now we've been focused on COVID, some of the other time that has been taking up a substantial amount of time is around our implementation of social emotional learning, which is another aspect of wellness. And as we begin moving further into that realm, we're doing the screener now, but when we begin to partner with schools and provide professional development, ongoing coaching so that it's not a one and done, so we provide sustainability, this person also needs to be able to support that and have that level of expertise and have the ability to be able to communicate with a variety of stakeholders, both internal and external to the organization. So we did take a number of those things into consideration, but that's the reason that we did not have the narrow scope of the medical component, because again, we understood and we agree that the board did not want this to be a replacement for the service that the health department is providing, but someone to be able to work collaboratively to provide that level of support and leadership.
Great, thank you. And just to be clear, I'm not advocating for medical staff. Public health is public policy with a health bent. It's very different. So, thank you.
Okay. Ms. Sizemore-Heiser?
Just briefly, Dr. Boyd, I think you mentioned that part of the reimbursement for this cost of this would be insurance payments. Is that correct?
Yes, that will be one mechanism.
Is that something the vendor is going to take care of or take the lead on, or who's the person in charge of interfacing with the insurance companies to get those payments?
Yes, that will be solely on the vendor. We're not responsible for trying to bill insurance, claim insurance. That's solely a vendor responsibility and not FCPS.
Good, that's what I wanted to clarify, because that's a full-time position in of itself, so I wanted to make sure that wasn't going to be our responsibility. And if they are unable to get insurance payments or don't do the job appropriately, does that come out of their money, or is that something that we have to then reimburse them for?
So they then, if they're unable to get the reimbursement from the person's medical insurance, they're able to bill or request reimbursement from federal grants programs around this level of implementation. And then if they're not able to, across all of the services that have been provided, on average get that $44.50 per team on average per day, then the balance of that would be our responsibility from FCPS.
And I'm assuming there's controls in your contract with the vendor to make sure that they do all those steps appropriately.
Yes, there's reporting mechanisms about services provided and all of that, so that we can check and cross-reference what is being shared with us.
Okay, I just want to make sure that someone's doing that and doing it well right before the bill comes to us, is what I'm trying to get at. I have one other question about testing, and I'm going to bring up performing arts in this. And I've brought this up before, and I've gotten a lot of feedback from our community around performing arts, our non-co-curricular extracurricular performing arts activities, and can vaccine requirements, testing, and then masks, similar to what we do for indoor sports, be available for our performing arts, because those are strenuous activities as well. There's actually a petition at the state level, a change.org petition by many families to petition the governor. So I'm just kind of curious, can performing arts extracurriculars be folded into this testing requirement to make it, and potentially down the road, looking at masks for performances, especially when there's distancing available?
The mask thing, we have spent a lot of time with our division council looking at the state rule, and our best legal understanding is the state's clear that we can't do that with co-curricular associated with our direct instructional program. We are hoping, I'm glad to hear about the petition, that there will be greater flexibility. I'll defer to Dr. Boyd about whether we can enhance our testing capability of other groups, but I don't think the contract with LTS is limiting us, that we could explore additional services for additional groups if we so chose. Dr. Boyd?
Correct. We can certainly explore that. Something that's written into the contract is we talk about a minimum of 10% of a random group of students. And so we can look at what additional services we might need to explore for other extracurricular activities. So we'll look at that, and then we'll follow up.
Thank you. My advocacy really for performing arts is, one, around safety in terms of similar to athletes, but two, around giving some of the same flexibility we can give to our athletes if we have testing and vaccine mandate protocols in place. But I understand some of that's at the state level, and just going to put out, maybe that's a legislative thing to ask for. I heard you correctly. If COVID transmission goes to low, then there's no testing of students, but continual testing of athletes and staff?
Yes,
That's correct.
Okay. Does this new testing, screening testing, because as I look at the mitigation strategies or prevention strategies, does this open the door to looking at test and stay, shorter quarantine, pausing? What's that sort of thought process?
I think it's going to give us enhanced capability, but I defer to Dr. Boyd if you want to add any additional comments.
Thank you, Dr. Braybrand. I do think it gives us the ability to explore it. We know that we couldn't implement test and stay or reduce quarantine lengths if we didn't have the ability to offer testing, because then it becomes an equity issue for some students being able to access it and others not. So I think that does provide a resource, should we go in that direction, that will be able to support the implementation of such plan.
Thank you.
All right, Ms. Tolan?
Yes, thank you. This is kind of probably, my first question is kind of along those same lines. I don't know that I got an answer earlier about our testing program is organized around non-vaccinated staff and students. And I guess I'm wondering why we don't have any random testing of vaccinated students. That's probably an add-on. I don't know, maybe there's a cost benefit. Just curious why.
Thank you for that question. So again, we are aligning our testing program and modeling it after the recommendation from CDC. And CDC expressly, when they talk about screening testing, expressly talks about persons who are not fully vaccinated. And again, so we've mirrored that program and that recommendation from CDC. We do know, in getting some feedback from persons, that some persons have shared, would that potentially be stigmatizing persons who are not fully vaccinated? What level of concern would be taken with that regard? That's certainly not our intent, and we are transparent about the process, and we're not, while we are promoting vaccinations, we're not taking a stick approach or saying that someone who has opted not to be vaccinated is making the wrong choice. We respect and honor everyone's choice. We're implementing this so that we can have, again, decrease our even low transmission in schools to potentially decrease it or eliminate it overall. So it's really in an effort to support everyone's wellness, and we would do this with the utmost integrity and being mindful of confidentiality and all of those things.
Yeah. I just wanted to bring up one other issue that hasn't been discussed here. It's not in the presentation, but wanted to make sure everyone was aware of it. I've been working with our facilities staff we had some findings of high CO2 levels in some of our classrooms at McLean High School. And there's a body of knowledge looking at, high CO2 levels, maybe less ventilation, perhaps that would be a greater spread of COVID. So I just want people to know that we, working with facilities, we're bringing in a third party to really look at McLean and what's happening there. And we are beginning a new procedure with our energy specialists that are already out in all of the schools to begin checking CO2 levels. Exactly how often and when that would be reported, I still need to talk with facilities about that, but I just wanted to let people know that that was happening. How was it uncovered? So it's a good story. We had a student brought in a CO2 monitor into classrooms and just did some random testing and discovered some higher levels. And I have to give credit to our facility staff. They jumped right on it and went in and tested. And sure enough, there were some issues in some of the classrooms. So McLean, being an older school, having not been renovated for quite some time, what we discovered is in this particular case, when the custodians over the summer waxed the floors, they just put the wax all over the floors. The vents in this older school are in the floor. So the wax dripped in, clogged the vents, and they were stuck. So we were able to remedy that and take care of that and improve the ventilation in those classrooms. But it's something, we're looking at doing further testing and really looking to use these energy specialists or other avenues to do more, testing across the district to make sure it's not an issue.
Thank you, Ms. Tolan. Were you looking for a response on that from staff?
Not really looking for a response because I don't see our facilities folks here.
I'm here.
Yes, hey,
All right, Mr.
Plattenberg,
Plattenberg,
do you
go
want
for
to
it.
add to that?
Mr. Platt.
Yeah.
Top of
If-
it,
if-
we can be glad
Thank
to
you
add.
so much. But yeah, absolutely. I'd love to address this a little bit. What was found out in this situation was the ratios fluctuate throughout the day, and an individual student brought something in, and there's so many challenges and opportunities with home monitors, if you will. But in this situation, what was described was accurate, and we've responded in kind. And so to the point, because this was something in our older facilities, all of our newer facilities as part of our bond program, design and construction, meet the current code requirements and standards and have CO2 monitors within the facilities. But some of the older facilities don't have that. So to the point, we've gone ahead and said, well, since we're having our teams out in the buildings doing these audits, we're going to go ahead and provide them, staff them up with equipment so that they can be monitoring the CO2 levels. CO2 levels fluctuate for many different reasons. If a mechanical unit goes off and it's filled with people breathing into space and we're not having good circulation, which ties back to the ventilation, one of our mitigation team measures monitoring, we can jump right on it. So it's really just an added supports that we're providing in these times where people are concerned about any indoor air quality. Whenever we've done samples, for the most part, we've been ahead of the curve. We did have some instances out at McLean High School, and like with anything else, we found that some of the units weren't working properly, and what Ms. Tolan described. But it's just another level of supports that we're providing to our personnel that are going to be out in the field, in the schools, so that we can be more responsive and more immediate and precise in our response.
So
That was your time. Ms.
that's my
Tolan.
time.
Yeah,
Okay.
sorry. Ms. Derenak Kovacs.
Thank you, and thank you all for this report. I am pleased with most of it, as I was able to talk to staff in great detail about it during the managers' meeting. One thing I do want to say, I do appreciate all the community partners who will be supporting our students on pages 8 and 9. That's extremely important. I do have a question, and if it was already answered, sorry, I was not here earlier. The test to stay option, would this capability be possible with this vendor?
We are exploring, we do have screening testing, and we'll be adding on the diagnostic testing with them after we've implemented the screening testing. So if it was the desire for us to move in that direction, we would be able to partner with them to support testing.
Supported as well. All right, thank you. And Dr. Brabrand, we talked about this. It was June of 2020, and Ms. McLaughlin, I appreciate your shout out, and Ms. Cohen, about us needing to do that. And where it was, the testing that was going on last summer was state funded in many cases. The examples that I was giving were state funded, and unfortunately that never happened here in Virginia, and locally it didn't happen. So the fact where we are
I think the random testing of the unvaccinated is what was happening back then. That's what we will continue to do. So between the screening testing and the diagnostic testing, and if we could add test to stay, if that's necessary, I think that will be important for us. Also, I think in looking through this and then having not looked at it in a week's time, I think I would like to know, I see Ms. Lloyd is here, what is our communication plan for this? Because this is a big new thing. It's happening fast. And did we speak to that earlier? Okay, if we spoke to that.
You have a copy, you should have a copy that Ms. Lloyd has shared with you earlier this morning.
Okay.
A
all
full
right.
communications plan ready to go out.
All right, thank you then. I appreciate that, and I will look at that. And so that is it right now, but thank you. I think we're on a good path. I look forward to going through that communications plan and seeing where we are. And please, I think it's extremely important. You know, we're trying our best to do things, but we need to make sure that the board understands if we're not meeting our goals and where the money that could be. You know, there were other instances where that happened, so we really need not to be able to make that happen again.
Thank you, Mr. Kofax. I'll go ahead and take my turn. Thank you to our staff. I know that these are three pieces that there's a lot of excitement around the direction we're headed in, and so I do want to express that and take the moment to recognize that. Given where we are, I do have some questions just in terms of the timeline for adopting the vendor and what that looks like, what we can anticipate, especially given some of the concerns raised earlier.
No, we have a vendor. There's not a timeline for the vendor. The timeline's been the last several months in working to get the right vendor, and I've been sharing updates. We have a vendor, and vendor is LTS.
Okay. In that case, do we have a time, check-in points with this vendor, given the considerations that were raised? I'm trying to think if we can monitor this in a more systematic way, given the concern of bleeding us out.
I want to remind, it's important. I've been superintendent almost 5 years, and as far as issues with contracts and inappropriate use of contracts or conflict of interest have not happened during my administration. And I pledge to you continued monitoring fidelity and reporting out on our contracts and contract performance. And I can assure you, we are not going to have this contract with LTS become a financial drain on Fairfax County Public Schools. If we are not meeting our objectives, you'll get a regular report. And if you see that we're not meeting our objectives, then we will go in a different direction. You have my pledge on that.
I appreciate that, and certainly not implying any, malfeasance or anything like that. I think in just making sure we're on top of it, to pay attention to that as it's, the burning rate of what that is. I also was wondering, in our next update, would it be possible to take a look at where the funds have gone, over the course of, I suppose it's a 2-week timeline here for us to reconvene to have this conversation, to examine that? And I suggest that, again, because there's always an opportunity cost. It's not that, we don't want to move forward with this, but.
I'm sure we'll figure out the right way to give you continued operational updates on all things, including this contract. And if there's a need with the chair and vice chair for the board to reconvene at an earlier time. I think it's important to ask questions. I also think it's important to have the grace that we've spent months to prepare and deliver a plan that you all asked for. If it doesn't meet the objectives, we will give you the update. But we have a full plan here. We are ready to go, and we're about to have a regional coordinated plan to vaccinate and to test our students. And I'm very excited about it, and I hope you all are too. Of course, we'll monitor. Of course, we'll manage, and we'll certainly bring any concerns, financial, operational, about this vendor or any vendor that we're having concerns with. But I'm very confident. We've spent a lot of time working to prepare to have this vendor join us and our partners. We've spent weeks, Dr. Boyd knows, nights, weekends, to bring you what has been brought today. And I really appreciate all the positive feedback the board has shared. Thanks. Yeah,
perhaps it would be helpful to clarify or rephrase. I mean, we're on the same team. We're all seeking the same goal. And the idea here is not that we necessarily are critical of where we are, just more so as we move forward, being mindful of, again, constantly reevaluating, revisiting, making sure that this is something we want to continue committing to, right?
Absolutely, absolutely. I'm very optimistic, though, and if we do have concerns, we'll certainly be bringing them to you, and we'll give you a regular report on how the testing and vaccination is going.
I look forward to that in our future updates. My final question is about the inclement weather days. Can we just get some context as to how other divisions are doing that, just so that we're on the same page?
I don't have that for you at the top of my hand right now. I can get it for you, and I'll put it in a Brand briefing or one of my Monday letters and give you that update.
Okay, just mindful of when it plays out, right? The community response to that will be important to anticipate. Okay. So I do see a couple of board members who are requesting go-backs. I'd like to just ask for a show of hands as to who would...
I don't want to go back. I just wanted a point of privilege to say something to Dr. Brabrand's remarks.
Okay, I see several folks. Okay, so we can maybe encompass that into time. Can you raise your hand if you would like to share something, regardless of what it is at this point? Okay, we only have 3 members. Let's do a minute, please, and go ahead and go in that order, and then we can move on, because we really are running behind here. So Ms. Corbett-Sanders was first.
So Dr. Brabrand and team, I very much appreciate all of the hard work you have put into this process in developing a testing program that we've all spoken about. I do have questions as to what are your metrics for, we're a little concerned, we need to take a pause on this testing strategy. And the reason I ask that is because Frederick County Public Schools just paused all of their testing because of lack of participation today. And so obviously they had a metric in mind. I'd like to better understand what your decision criteria are, and whether or not we thought about only putting the bulk of our resources on testing in those places where we have the least vaccinated kids.
I'd answer, and then Dr. Boyd add. Obviously, our metric is that 10% per site, and she shared that site, I think you said, was 2 schools. So we're going to have to monitor if week after week, let's just say the first month, we're not meeting our metrics. I think that is somewhere where we would come back and reassess and make a recommendation to the board. I mean, the first very week, we're going to have to get stuff up and running, so the very first few weeks, but I'd certainly say within the first month to 2 months, we need to be seeing us being able to meet our targets. The very first week or 2, it may be building, but I don't know, Dr. Boyd, anything you'd add to that?
Now, I just concur with Dr. Brabrand. We know that some families will want to immediately engage in the testing program, and some families may want to see how it's going. Let me talk to my neighbor, at whatever, evening activity to kind of see how their child is responding. And we want to make sure, again, I heard somebody talk about return on investment and things like that. It's still going to be a workload, even though we have the vendor there. So we want to make sure that the juice is worth the squeeze, if you will. And so we'll be monitoring that data. If we can't hit 10% consistently and it's looking like our families, this isn't something that they want, then we have to take that into consideration.
So along those lines, did we consider a mobile testing site so that we're not doing a per site, per building situation, but rather a regional approach?
So the teams will be moving around. The teams, just the way the vendor has it up, the teams will support up to 2 sites per day, but they will be moving around. So each school won't have a testing team at their school every day of the week. It may just be that, the testing team is at Bush Hill on the first Monday this week, the second Tuesday, and I'm just making up something up random, but based on the need and the data about how many students need testing at that particular site. But we'll monitor it.
So if you're
That's
saying
your
one
time,
team
Ms.
for 2,
Corbett-Sanders.
that's 438,000 per week if you only do it once a week, correct? That's
Say
your
that one more
risk.
time, I'm sorry.
That's time, so just
Okay.
please wrap up.
I'm trying to figure out the risk factor. And so if you divide our schools in 190 down to 95, and at this price, then instead of being 875,000 as your risk factor per week, if you're only doing it once a week, it brings it down to 438,000 per week is your risk?
Yes, because the teams can serve up to 2 sites per day. And again, if we just have a school that has significant volume, like one of our elementary schools, if a lot of families say, yes, I want my child to be tested, that one team may need to stay at that one site for the whole day just because of their volume. So that consent is going to drive that scheduling.
Okay, thank you. Dr. Anderson.
Just piggybacking, going off of on that, is there any way to average out what the teams are doing? Because what I think I hear is one school may have a lot of traffic, another school may have minimal traffic, but we're looking for 4,400 per site. Is there any way just to say that this is what needs to be met, just a complete total? And if we meet that, then make some decisions?
Yes, and Michelle's here, and that's actually written into it. See, the other Michelle is better to talk about procurement. It is written as an average of 4,450
Okay, that's the average.
per, so if one site is huge.
Got it.
Yes.
Okay, thank you. The insurance piece, I think I'm unclear. They're going to take care of the paperwork, so that means parents will be turning over insurance information to them?
Correct. On the online registration portal, parents will be prompted to enter their health insurance information. And so the company will be able to bill their insurance. If they're unable to receive reimbursement from their insurance, they'll be able to bill this federal reimbursement program. And if they're unable for some reason to get reimbursed there, and if our average of $44.50 per team per day isn't met, then we would be responsible for the balance. And Michelle is nodding her head. That's always a good sign.
Okay, thank you. Now, how does this, is there any correlation between this testing and other diagnostic testing that may be coming as compared to the at-home tests that some schools will be provided or were provided?
Yeah, so those are 2 different programs. Dr. Anderson is sharing the state that provided school divisions who requested them a certain number of at-home COVID testing kits based on your student enrollment. We did receive those tests. Those are called Buy Next Now kits that we are disseminating to schools so that if families need access to testing, they can take those tests home and test their child as an at-home test. That is something that is separate from this particular vendor. That resource, if we engage with Vista, we would have prioritized access to those resources as they remain available. And so we're still having some conversations there, so we may have some additional testing supports through the state program.
And going back to the insurance, just to confirm, if a family does not have insurance, then they can apply for the state grant. It doesn't come out of FCPS.
Correct.
Okay, thank you. I still want to say that I would like some better information in terms of where the funds will be coming from, if and when FCPS would have to pick up the slack, and to also affirm what Ms. Corbett-Sanders said. I'd like
Thank you,
some
Dr.
sort of
Anderson.
metric.
All right, Ms. McLaughlin.
Squeezing this in 1 minute flat. I would really like to understand, why is our priority on screening versus the diagnostic test to stay? And if we're talking about the incentive for families to participate, what families want is to be able to keep their child in school if they don't even necessarily have COVID and they are asymptomatic. So why is our focus and our money going to screening and we may not even have the participation levels?
Sure. So the reason we're focusing on screening is so that we can reduce or minimize transmission in our schools. We, again, as Dr. Brabrand shared, we're doing pretty well, but we have had in the last month approximately 17 or 18 outbreaks where transmission has occurred in school. And so the intent of screening testing is to identify those asymptomatic persons and get them out of the rotation earlier, if you will, so that they're not sitting in class and I'm sitting next to Dr. Anderson and I subsequently get her sick and I subsequently get Ms. Laura Jane Cohen sick. And so that's the intent of that piece. But that's just one option and one round, but we are engaging so that we can support multiple testing options. And so that's why we folded in the diagnostic option into the contract as well. And the diagnostic testing would be something that if we move in the direction of test to stay, that's the testing that would be utilized for those persons who have a known exposure to a COVID positive case.
So I just want to emphasize that the chart you all gave us, that we're looking at about 4,000 students, when I did a really quick math, over the course of a month, that were affected by quarantining or close contact paused. So 17 cases versus all those kids, I'm a little worried that the screening, that we want to maybe make sure we caught those 17 cases a week versus what Test to Stay can do for the thousands of kids over the course of a month that sit out of school. I just want to urge you all to please make that a priority with this company. And you guys, the $435,000 a week, if I heard Ms. Corbett Sanders, is our risk level.
Thank you, Ms.
I
McLaughlin.
don't even know why we're rushing into the next work session, and that's just hanging in the air. And I'll have to make my comments to Dr. Brabrand when I get my time at the next work session
I
this
think he's been
afternoon.
trying to speak, so let's hear from him, and then we're gonna take a 5-minute break.
I do want to just, look, board members share feedback, and I understand what Ms. Corbett Sanders is saying. We have insurance and a government fund of billions of dollars, I don't know the exact amount, that's for all of this COVID testing. I am not worried about continued weekly exposure at $400,000 a clip. I'm not. If we see that kind of impact, we're not going to continue to do something that would take that kind of impact on our financial operations. We went with a vendor to do what this board asked and to minimize the impact on schools. And we'll continue to monitor that and move forward. I do want you to know, we do want to look at test and stay if the CDC says it is the best practice. We're following best practice by doing this testing that has just been outlined. The health department has continued with the 14-day because they believe it is, and the CDC says it is best practice, although there are 2 other options that have higher associated risk. Our risks have remained extremely low. We haven't had to close the school, and we want to continue to, of course, do everything we can to get kids back in. I think a nugget that I would just say to the public and to all of you, that one of the things the public health folks have helped me understand is public health is thinking about the safety of all, not just the one. And even yesterday when Colin Powell unfortunately passed away, God rest his soul, who was, by the way, I just do want to take a moment to say he was a frequent graduation speaker in Fairfax County Public Schools and an honorable man and patriot. But even to reduce community spread continues to help limit our most vulnerable, who even when vaccinated can still be susceptible to a breakthrough infection. So this is all still about the needs of the many and balancing that with the needs of the few or the one. So we'll continue to do that. We'll continue to bring updates. I know this is one of the things board members look forward to, are these operational updates. We have a new name for it now. It's not RTS because we're back in school. And it's a lot, and I just want you to know we're committed to getting it right, and I'm committed before I walk out of here in my final year of the superintendency to getting our schools back to as close to normal operations. We have to be honest, they're not there yet. And what we've got today is what I hope is the final stage in wrestling COVID straight to the ground and alleviating the concerns, particularly at our elementary school, about COVID in our schools. And I think the vaccination coupled with the testing is a 1-2 punch that's going to knock COVID out. Thanks.
All right, thank you, Dr. Brabrand, Dr. Boyd, Mr. McDonald, and the full team of staff. Right now, let's take I mean it when I say 5 minutes, folks, okay? So 2:56, everybody's back in their chairs between transitioning to the program review portion. All right, folks, we have just about 1 minute to be back in your seats, please. All right, folks, it's 2:56. Please come to your seats. Yeah. Folks, if you could please come back to your seats. It is 2:56. We do have quorum, so we'll go ahead and get started. We are going to be taking a look at the program review. Before I pivot to staff, I do want to make sure that folks are aware. This is a follow-up from the forum topic that came forward in the past. We requested of staff to come back with an evaluation. They had sent us information before this, and now we're in phase 2 to take a look at what programs we are revisiting. I do want to bring to everyone's attention that while we had, of course, the intention initially to take a look at what potential additional programs we can have to discuss which programs we want to delve more deeply into, given that we are going to be working on a superintendent transition as well, we should be mindful that it will make sense for today to look into what programs we may delve more deeply into, which staff will provide recommendations on, and then perhaps in the future revisit when we do come up with a strategic plan and a broader set of goals with our new superintendent in the future. So I will, and I'll let Ms. Tolan and Ms. Sizemore-Heiser comment on that in their turns to elaborate further. But let's go ahead and start with our staff presentation.
Ms. Omesh, I asked to be recognized as a point of privilege.
I'd like for us to move to staff presentation, given the time.
Madam Chair, it relates to where we're going for the rest of this work session.
Go ahead.
So my colleagues, I've spoken to a few of you already. As we know that we are now 2 hours behind when we were going to start. There has been a lot that we've had to work on. So I'm going to propose, with the support of a colleague, that staff present today their program update, and then the board will conclude and resume our Q&A on this at a later point in time that the chair and vice chair can find on our calendar, because this is not time sensitive. And there are some board members who are going to have to leave. And I do think that in order for us to do our best work, I'm concerned about going later beyond that with Q&A.
I'm happy to pose that to the board. I do want to ask Ms.
No, the way it works is I made a motion to the table. It's going to be seconded by Dr.
All
Anderson.
right, Dr. Anderson seconded the motion. My understanding was we didn't do motions at work sessions anymore. We can see if there's a consensus. And I would just ask if Ms. Pekarsky could speak to the schedule and whether that's feasible. But No, I understand the procedure. We have agreed as a collective not to do motions at work sessions. That's fine, we can ask. So in any case, who would like to speak to this motion?
Technically, I introduced it. You go ahead, yeah.
I know this is a lot because this is my binder, and so there's lots of questions, more questions than we have the time to take hold of at 3:58. So I'm in full support of hearing it and then coming back to another time to really delve into this, because I'm really hoping, in addition to getting all this information and really absorbing it, that this also helps us to get to the point that we talked about at our budget meeting, which I know I put on my documents for the budget team. Where can we take a look at some areas where we could repurpose funds? I cannot do this fully, knowing that we have not even begun. This is it, all of the stuff at 3 o'clock. So that's why I'm supporting this motion.
Anyone else want to speak to this motion? Okay, Ms. Sizemore Heiser? Okay, Ms. Keys-Gamarra?
I would, I'll wait and hear everybody.
Did anyone else want to speak to this? I'm happy to myself. Okay, Ms. Marin?
I mean, here's,
Ms. Sizemore Heiser?
sorry. Ms. Toll and I spent a lot of time working on this. We brought this forum topic in May of 2021. We worked very hard with Dr. Presidio to do this forum topic in phases, and we spent a lot of time planning with Dr. Presidio, with phase one being sort of the incredible amount of data that he and his team have provided us in June, and then again recently. Phase two was this work session to kind of go over their analysis and the presentations of their data, which is what this work session is about, in order to then give the team guidance as to which programs to do a little further deeper dive into in phase three. The purpose of all this, is kind of as we talk through working with Dr. Presidio, with a new superintendent starting potentially next summer, to kind of have a good framework of what programs do we have, where do we have them, sort of a little bit of the why and the analysis, so when we do get a new superintendent coming in, we're able to have those strategic conversations with him, her, or they, regarding sort of what programs do we want to have, what do we want to put our support behind, sort of what do we want our system to look like broadly. And so while it is not, I agree, time sensitive in terms of things right now, there is a plan that we started in May 2021. So I would just put out to my colleagues, I also fully respect that we've done a lot of work today. We are all very tired. And I want to make sure we do this work properly and correctly with our best thinking. And I understand if we're not there because of the late hour, I respect that as well. And I don't want to stand in the way of my colleagues from that aspect. But I do want you all to know that, Ms. Tolan and I have spent many, many hours working with Dr. Presidio on kind of trying to chunk this really humongous project out in a way that can provide us, I think, a lot of good data, analysis, information on sort of the state of FCPS programming to have those conversations with our new superintendent. So all I would ask is that if we postpone, and I totally get it, that we work to prioritize bringing this back in a way that we can do this work in time to have those conversations with our new superintendent. And the other things, we did make a lot of phone calls. We didn't get hold of everybody yesterday, but we did talk to quite a few people to kind of try to help streamline and frame out what I've just shared today for this work session. So, I think I'll just end by saying I think there's always a tension I feel in sort of the immediate fires of the moment, because we have so many of them, and sort of that long-term strategic thinking, strategic planning, goals to what we want to do. Ms. Keys-Gamarra, you actually said it to me. You said it in a work session that really resonated with me. Was we can't keep waiting, right? And that's kind of where that tension that I feel like we're running into. So I know. I'm wrapping it up.
Okay.
So I haven't spoken much today. So I just wanted to say that I just want to put that out for my colleagues. I don't want to make anyone do work when they're tired, but I do want to put out that there's been a lot of work in this.
Thank you.
So I would just like to add to that, we've done a lot of work already, and looking forward to, over the next year, how we want to be strategic, looking at the work of the school district. We have a number of things in the works, right? We have a review of our special education program. We have our AAP review that we've done. Our CTE program is being analyzed by an outside group as well. We were looking to this piece to be a way to look at some of these other non-core programs and gain information as well, so that we would have a really nice package of all of these different reports to, work with the board, the leadership team, and the new superintendent. So maybe I would like to see the presentation. I know the presentation is chock full of information, and I understand the nervousness about not having time to analyze it. There are recommendations at the end of the presentation, so perhaps, we could be creative in seeing the presentation, looking at the recommendations, and thinking about how maybe Rashna and I could work with, the board to try to, and Dr. Presidio and, Clemenco, to get this information to them so they can continue with this work, and we can move into phase three. So I just put that on the table if we could try to be creative.
Thank you. Time check, we're 10 minutes into the meeting discussing whether to have it.
Just to be clear on, I want to
No,
be
no,
clear
no,
on the
no.
proposal.
Ms. McLaughlin,
The
we're going in
proposal
order.
is
We have
not-
speakers,
The
please.
proposal is to have the meeting. The proposal is to get the presentation.
All right.
Don't
Ms.
say,
Keys Gamarra.
you misstated it.
Okay. So I thought Ms. Darnett Kofax was next, but that's okay. I really do want to hear the presentation. I wonder, I understand, I'm tired too, guys, but I am worried about the lineup that Elaine and Rachna laid, yeah. It's not a comedy routine, I swear. I want to respect that work. I would like to hear the presentation. Perhaps an amendment is that those who want to get some preliminary questions out can do so. And also, if there is a critical question for today, at that point, you might be able to ask the board so that you can get the information you need to be able to move forward, I think would be my alternative proposal, which would allow people who want to not do the whole thing today, but at least get the critical information so that we're not just waiting.
Thank you. Ms. Marin?
Yeah, I agree with Ms. Sizemore-Heiser in wanting to prioritize to bring the work in a timely way. I'm eager to hear the proposal, so I can support the motion. But what I do want to say is that it's not just in how we're going to bring the work in a timely way, but in a strategic way. And Ms. Sizemore-Heiser and I did talk about this. We've got this work, we've got the strategic plan that I know our board leadership has been trying to schedule for us to talk about those goals as well. And then we also have the comprehensive plan. So these are three big chunks of things, and I think that our conversation about this could go down a path of being about specific programs and the merits of them and the return on the investment, or it can be about the criteria by which programs are, implemented and kept. And so I'm in favor of the motion, and I would love to be part of perhaps a spin-off team joining Ms. Sizemore-Heiser and Ms. Tolan to help cue that up for the board for a really focused conversation that's not just looking at the merits of each program and pitting one against the other. Thank you.
Thank you. Ms. Darnat Kofax. Actually, I'm sorry, Ms. Pekarsky.
So I just have to say that I think sometimes we get in our own way. We've now spent 15 minutes talking about whether or not we should have this and end on time. We did allocate till 5 o'clock. Sometimes we've got to be flexible. I don't disagree, but I don't understand why we need to derail sometimes with emotion when we could go to 5 o'clock and then see where we are and then decide. So, I think I would just urge us to maybe try to be a little bit more flexible as we're in these meetings, and when we need to do a check, we can do a check, but we've lost 15 minutes now. So I just, I think people watching us will just think how comical of us, and I'm struggling.
Thank you. Ms. Darnat Kofax.
Okay, ladies, this is where we are. I had spoken, and I had spoken offline to Stella and just said, we need to end at 5. So that's what we need to do. Whether or not we get to questions, I would be inclined to listen to the staff presentation, which I know is going to take 45 to 50 minutes. And then no, Sloan, you're laughing. Is that true? I thought that's what that's what I was informed.
It's always hard to estimate. I appreciate this conversation, and I will not shortchange the presentation, but I will do it as expeditiously as possible. So hopefully under 45 minutes.
Okay. This is where it gets frustrating as a meeting manager.
If you know what, this isn't a business meeting, so.
Okay, Ms. McLaughlin,
Just pull
kindly.
it off the table and let's go till 5
It's her time to
o'clock.
speak to the motion.
But
We're
let's
going to
just go
decide
till
on the
5
motion after
o'clock.
that.
Just go till 5.
It's on the table now, so I can't
This
decide
isn't a
that.
business meeting, it's a work session, it's not formal, so it's okay.
You want to pull it, Megan, and we'll go till, Ricardi, are you okay with pulling it? Yes. This is what we're going to do. We're going to go until 5. The presentation will happen. We will ask as many questions. I personally do not feel that, I felt this way before this started, that we could come to any conclusions based upon this. And I spoke to Sloan and his team. He has literacy on his plate. He has ESSER. He has a special ed review, the AAP review, the goal reports, and this program. And how are we going to do all that strategically as a board? I think that's what you guys were speaking to, Ricky and Megan. And excuse me if I don't know, head nods, whatever. So I was concerned about this, and we had 4 hours. Now we have less than 2. So let's get started with the presentation. We will take one round of 2-minute questions, and then we will see where we are. Where we are at 5, we end at 5. Is everybody okay with that?
Thank you.
Nod heads.
And again, as
revisiting,
we
Karen.
said, we're not doing the entire work right now. So Dr. Presidio, I'm sure you can help us frame that in the beginning, so that we can move forward with recommendations that they're going to delve deeper into for the next phase when we do meet again. So please, Dr. Presidio.
All right, well, very good. And first, good afternoon, everyone. I know it's been a long day already, but we definitely appreciate this opportunity to present this information. Folks have been working very hard to pull it together. I do want to start by thanking Ms. Derenak Koufax and Ms. Omesh for helping us plan this work session. We had several discussions about how to do this in the most appropriate way, and I really appreciate Ms. Sizemore-Heiser and Ms. Tolan's work in preparing for the work session as well. A lot of folks contributed to preparing this information. This is a very large report. Obviously, there are a lot of information posted on board docs. You do not need to review all of it. It's kind of, a lot of it is kind of skimmed to get the information that you want when you want it. So have a little bit of assurance there that you don't have to have all of that reviewed. But a lot of folks did work on this report, and I want to just recognize a few folks. First, Noel Clemenco, our Assistant Superintendent in ISD, who's here with me. Jen Glazier, our Director of Counseling, College, and Career Readiness, to help answer questions. And then a large team of folks who helped compile the data. And in particular, I want to call out Dr. Yubo Zhang, who's in the back with us, for collecting a lot of this information for us, as well as Jan Bonner on the financial side and the analysis side. So we really, really appreciate their help getting this report pulled together. You can see the major agenda items that we wanted to try to cover today, and as Ms. Omesh and Ms. Derenak Koufax said, a lot of this is just sharing information. There's not decisions that have to be made today by any means, so we definitely, I think, can accomplish these objectives. So to start out, what I wanted to do was reframe and revisit for everyone what the board had agreed to do when you developed the purpose and the scope for this program review in your forum back in May of 2021. So at that time, during that forum, you directed us to complete a program review to ensure that our programs are aligned to 21st century best practices and Portrait of a Graduate outcomes. And you requested certain programs be looked at in particular. So the scope of the programs was limited to those specifically identified by this board. And we're going to go through, obviously, which each of those are in just a minute. But it was limited largely due to the fact that many of our other programs are already under review, or you already receive continuous monitoring reports on those programs as part of other reports that we provide to the board, like our strategic plan goal reports. This program review is to be conducted in the 3 phases that you see here. So phase 1 was a collection of enrollment information and program offerings by school location, demographics of enrollment in those programs, as well as some cost information associated with those programs. We provided that back in May, and it was a significant amount of data. Today is phase 2 of the program review, which is an opportunity to present kind of some summary findings as we looked at that data and pull out some of the highlights or some of the nuggets that we think are really important for the board and the community to consider. And then phase 3 would be for the board, either today or in the future, it does not have to be today, to decide on a limited subset of programs that you might want further analysis regarding. So as you think about working more towards resetting and updating the strategic plan, as you think about your board's strategic goals for your work going forward, there may be programs that you need additional information about in terms of how we might expand those programs and make them more accessible and more available to more students. Or there may be programs that you may be interested in getting more budgetary information, more return on investment information, or even considering whether or not those programs still are in the best interest with our goals as a school system in FCPS. So this is, just for your reference on slide 4, the exact language that the board approved. I'm not going to read that to you in the interest of time, but again, representing those 3 phases of analysis. And again, we are in phase 2, the sharing of the information today as part of these 3 phases of the program review. I do want to pause here and point out very specifically the programs that were included in this review at the request of the board. So the board, again, unanimously approved to look just at these programs here. So if there's something that's not on the list, remember that was something we discussed during the forum and decided not to include in the scope of this particular program review. So you'll also notice that there are kind of 3 buckets when we think about the types of programs that we're looking at here. The first bucket are those instructional programs. These are programs largely that you can identify in the operating budget very clearly. They have operating budget categories. They're part of our staffing standards when we think about how we staff our programs in schools. And again, I won't read the whole list to you there. You can see that. The second category are instructional initiatives. And these are not funded really with operating dollars. They're either funded as strategic improvement initiatives or innovation initiatives with grant funding or with department operating dollars. So you won't really see these explicitly listed in the operating budget for FCPS. Additionally, staffing for these initiatives, the second bucket that you see here, the staffing for these programs are not part of our FCPS staffing standards. And then the third category, or the third bucket, are those support services and programs that the board wanted to hear more about. All of these programs that you see listed here fall under the umbrella of our College Success Program and are really aimed at supporting traditionally underrepresented student populations with making admissions to colleges and universities and supporting their success in post-secondary education. So we're going to look at each of these programs as part of today's presentation. I want to just unpack a little bit about the criteria that we use, though, when we talk about, how do we make decisions as a school system about what programs we offer, and how do we evaluate the success of our programs? And this was kind of one of Ms. Marin's questions just a minute ago. It's really important to have this information, I think, to kind of guide the rest of the discussion. So when we think about establishing programs, first we think about, what are those federal and state requirements? So there are certain things that, of course, that we're required to offer. At the federal level, you can think about programs and services related to, IDEA, for example. At the state level, you can think about making sure that we have programs that align with the graduation requirements, which are always changing in the state of Virginia. We're always adding new requirements. We recently, for example, added economics and personal finance. That caused some shifts to course-taking offerings. The state right now is in the process of implementing computer science standards. That's going to cause some shifts in some of the requirements and programs that we offer. The next criterion, though, is really important, which is student interest, right? What are students' needs, of course, the types of services that they might need, but what are their interests as well? And this is really important, particularly when we get to the secondary level, because a lot of those non-core programs that we offer and staff are really based on what are students' passions? How can we engage students and keep them engaged in the learning process? And how can we capture their imagination around what's possible for them and for their future? And we want to be able to offer the types of programs that really align with student needs and interests. Third is our community interests, and that's largely reflected by this board. So as you are elected, of course, to represent the community, thinking about the kinds of program offerings that we have for students across our system, it's a large reflection about what are our community's needs and interests. I will say that part of the tension is always what are the things for the entire system and what are things that maybe a particular school might have an opportunity or a passion to explore that we want to make sure that we take advantage of. So that's one of the tensions always, I think, that the board has to balance out. Of course, the next is alignment with 21st century educational outcomes, particularly our Portrait of a Graduate attributes. That's incredibly important. That's really our North Star in the school system, is to help students develop those attributes that are even more important than the content learning that they may develop in some of the courses that they take. We also look at career trends and workforce needs. That's obviously important when we think about career and technical education offerings that we have. and making sure that what we offer is in alignment with what those workforce trends and needs are. And then thinking about available resources. So obviously budgetary, financial concerns comes into play here. How much does it cost to run a program? Not just looking at staffing costs, materials and supplies, but facilities as well. You can think about some of the programs that we offer, like our nursing program or our residential construction program or our HVAC program. Those are all things that are highly specialized, that are amazing learning opportunities for students, but we can't offer them everywhere at every base school just due to the facilities issues and challenges, for example. And then last on here, I do want to go ahead, and if you could help us by clicking on that link where it says Program Summaries. I want to point out that one of the things that we have done in the Instructional Services Department is published essentially our program improvement plans for all of these programs, not just the ones that you see here, but all of our core programs as well. This is published on the website. So much like a school develops an annual school improvement plan, our program staff and our program coordinators work on program improvement plans. So they establish continuous improvement goals. They have specific strategies that they've identified to support those goals, and they have measures of success. So if you were to open up, for example, let's just go to, scroll back up a little bit higher. Why don't you go to Get to Green for me? And we'll click on Get to Green as an example. And if you click on View the Get to Green program summary and open that up and scroll down, you'll be able to see kind of a brief narrative description of what that program is, the program improvement goals that we have, the improvement strategies, as well as the measures. And this is really important information, I think, for the public to know about, because when we talk about continuous improvement and accountability, these are things that are built into our system in terms of how the department operates, which is really important. So if you wouldn't mind, I appreciate you doing that. If you go back to the PowerPoint for us, and I'll try to pick up the pace a little bit here. And Ms. Klemenko is going to start to nudge me if I'm going too long, right?
Yes.
Okay.
Absolutely.
Uh-oh, now I can't get it to advance, so. All right. This is a really important slide that I want to call everyone's attention to, because when we have discussions about the programs that we offer, this is basically an illustration of how we make decisions about what all schools offer. What are those standard programs, required programs, standard course offerings, and what are the things that schools have discretion to offer? They may choose to offer them. Many of our schools might, but they're not offered necessarily in all of our schools. So I kind of refer to this slide as above the line and below the line. So if you look at the elementary program and look at what's above the line, we of course offer the 4 core: language arts, social studies, math and science, health, PE, music programs, art and library. All of our schools are offering those programs, following the program of studies and implementing them in similar ways. Below the line, though, you see some of our schools do offer many of our schools offer additional programming. These are things, again, that are not required to be offered in all of our schools. So here you see world language immersion, STEAM programs that are offered, Get to Green and Global Classroom. So part of, I think, the discussion for this board perhaps might be, where does the board want to draw that line between what's required in all schools and what is optional and what's additional? Similarly, I won't go through the list for secondary, but again, you see that kind of same framework of what's above the line and what's below the line. A few key themes in looking at all the data. Dr. Anderson has a binder there. She probably has more binders if she printed everything off with all of these materials. Again, not that we would expect you to be able to review all of those. You can skim them and find the information that you need. But a few key themes to point out. I do think it's important to note that, again, all of our elementary schools, for example, have universal access to general art and music. And it's really important because we also differentiate those experiences at the intermediate grades, where students can choose to take band or orchestra or chorus as part of their instructional experience. And the most important thing, which I'm not familiar with another school system our size doing, is we provide instruments for any of our students who want to participate in those music programs free of charge, right? So if the students have that financial need, we ensure that they get the instrument and they can participate in that program. That's a huge equity commitment that this school system has made for a number of years, and something that I think we need to be very proud of. When we look at some of our elective programs, our CTE, Fine Arts, World Languages, those of course are offered in all of our middle schools and high schools, but there's some distinction about the types of courses and the number of courses that schools offer. So in the attachments on board docs, you'll see for each school which courses are offered, as well as how many students are taking those particular courses listed by school. So if you wanted to go in and do a comparison with some of the schools in your district, for example, perhaps even do a comparison with schools in your district and another district, you certainly could do that. And if you needed help with that, that's something that we could help you with as well. Also, 76 of our elementary schools do not have world language programs, right? So about half of our elementary schools have world language programs and about half do not. Again, there's different types of programs, and we'll talk about that more in a minute. Another point that this board has asked about in the past is around our academy programs. So 6 of our high schools offer academy programs. Those are open for students to attend from other schools, but of course there are challenges with scheduling, bus transportation that often limit some of those opportunities for students, even though enrollment is open for them. You'll also note that we do have a small number of magnet and lottery run programs that we run centrally in the division. That helps, of course, with open access for students in an equitable way, but there are still barriers there in terms of families' language barriers, transportation barriers that exist, scheduling barriers that exist there as well. And then when you dig into the demographics of the student enrollment, there's a lot of things I think that pop out, but one of the most, I would say, most concerning issues that pops out looking at the data is that when we look at our AP and our IB courses, which have been open enrollment for really probably 2 decades, we still see disproportionately low enrollment for our Hispanic students, our English language learners, and our students with disabilities. Similarly, when we talk about our instructional initiatives, as I said previously, those are supported centrally. So you'll see a variance in terms of the offerings for Get to Green, Global Classroom, and STEAM across our schools. That implementation of those programs does vary by level. So we really do need to continue probably to analyze that and think about strategically how can we support schools that don't have those offerings now. And then those instructional services and supports, those, again, are really distinguished by the student population needs. So when you look and you compare the offerings and the opportunities in some of our schools, schools that have larger percentages of economically disadvantaged students tend to have more of those opportunities for those programs in the schools because they're, of course, aimed at supporting historically underrepresented student populations and making admissions to post-secondary education. So continuing on, this is a very high-level summary of all of those supplemental charts that you have. So basically what this chart is representing are for those particular programs that the board asked for information on. What is the percent and number of offerings by region for each of those programs? So for example, looking at that first row, secondary world languages, you'll see that each of our regions, there's 100% representation of secondary world language, of course, because by policy and regulation, we require middle schools and high schools to offer secondary world language. So that percentage is just saying, for example, in Region 1, out of the 10 secondary schools, middle and high schools in Region 1, all of those schools offer world language. It's not telling you which world languages they offer, at what levels. All of that's in the supplemental information. But we wanted to at least give you a high-level chart to help you maybe identify some areas where you want to dig in and look at some of the supplemental data in more detail. I think that pretty much speaks for itself. Happy to answer questions about that as we go forward, though. Slide 10 is a sample, again, of the types of charts and graphs that you'll see in the supplemental report. So for each of these programs, you're going to see our overall demographics, student demographics of the students that are participating in that program. So here we're, again, looking at secondary world languages. And as you kind of track around, you can see that 39% of the students taking world languages in FCPS overall are white, 22% are Asian, 23%, or is that 29? I can't even read it, it's so small. I think it's 29 are Hispanic. This tracks very closely to the proportional representation of students by ethnicity category in FCPS. Some of the charts do not track as closely as this one does, so that's another thing to kind of take a look at. You'll also see how that's changed over time in the chart on the top right-hand side. So we're giving you 3 years of data to look at. So we'll see some trends that can be identified in some of the programs over time where maybe the demographics have shifted a little bit. And then lastly on that slide, there's a chart that shows in each region, by each school, how many students and what percentage of the students in that school are taking that program. Okay? This again is secondary world languages, so it can be broken down into the particular language. This is still at a higher level to help you. So what do we want to do next is go into kind of the summary information that we prepared for each of these programs that the board requested information on. So first are our instructional programs. Those programs, again, that are part of the staffing standards that we have in FCPS and have budgets that show up in the overall FCPS operating budget. As you see the elementary, middle, and high school core operating budgets in the budget book. So there's a lot of information on this slide, and I have a slide like this for each of the programs. I'm not going to read everything on each of these slides to you, but I want to unpack the first slide so that you can kind of see the type of information that you're getting. So on the left-hand side, there's a little bit of a narrative. This gives you kind of a highlight or a nugget of what this program is all about. Again, our elementary art and general music programs are provided to all students in our elementary schools. And then at those upper grades, those intermediate grades, grades 4 through 6, students have the opportunity to choose to take orchestra, to choose to take band, or to choose to take chorus. So there's some choices that they have at those upper grades. We've had, again, a lot of state and national recognition for the programs that we offer and the quality of the programs that we offer in Fairfax. At our board meetings, we often have our students in the fine arts come and perform at the opening, and we see the quality of those performances and the type of experiences students are getting. And I think by continuing to provide that Instruments for All funding, ensuring that all of our elementary students who want to participate can get those instruments free of charge, this is one of the things that I think we need to be most proud of when we think about this program. Certainly these programs are related to our Portrait of a Graduate goals and aspirations, and you'll see a staff recommendation on here, of course, is to continue to offer these programs. So you'll see a recommendation on each of the programs when we look at each summary slide like this. On the right-hand side of the slide, there's a number of different pieces of information. The first is the schools. So we'll tell you, how many schools or what percentage of schools offer this program. So for elementary, fine arts, all of our elementary schools offer it. You see next the enrollment. So 96,000 approximately elementary students participate. That's 100% of the elementary student population. You'll note then 6,000 students choose to participate in band at those intermediate grade levels, and about 11,500 choose to participate in orchestra, for example. Moving to the right, you see the box that's labeled criteria. That aligns back to that slide that I talked about earlier that talks about the type of criteria that we use when we decide to implement a program, or the type of criteria that we use to set those continuous monitoring goals for our program. So the criteria that this program most closely aligns to, of course, are those state requirements, student interest requirements, community interest, because we have a lot of community support for our arts programs, sustainability, and of course is aligned to Portrait of a Graduate. That last row on the slide, the first box there, the cost, it's important to note that our elementary fine arts programs are part of our T staffing formula. So again, the number of students in that particular school generates a formula that we use in financial services to generate a certain amount of staffing that schools receive to be able to offer those programs to all students. And then that T time is used to provide teacher planning time at the elementary level. Excuse me. A few special considerations. We do want to make sure that we're really monitoring student participation at those upper grades in orchestra and in band and in chorus, because if students start to disenroll and choose not to take those courses, that will have an impact on middle school, which will then have an impact on high school. And one of the things that this board supported was hold harmless staffing this year at our secondary level for our fine arts programs, because we know that during COVID, students didn't have some of those in-person experiences. They didn't have an opportunity to participate in performances, which they get very excited about and builds their continuing engagement in the program. So we're going to have to continue to watch that. And then accountability is how do we measure the success of this program? We use those program summaries that I showed you on the website earlier for all of these, but we also, of course, look at things like grading and reporting and monitor how students are doing in each of the programs. Secondary fine arts, and I'm going to go a little bit faster through these now that you kind of have the format of how these are set up. But secondary fine arts, again, offered at all of our middle and high schools through our electives programs. You'll note that the middle school enrollment is significantly higher than high school. That's largely due to the fact that there are fewer elective choices at middle school than there are at high school. But again, we need to continue to track and monitor that because we want to make sure that kids are continuing to matriculate and participate in the arts at high school. Alignment to our criteria is substantial. We do, again, have general education staffing formulas to generate the staffing for each of these programs, as well as continuing need to monitor the programs. But these, again, are programs that have received a lot of state and national level recognition, and we certainly want to make sure that our students have opportunities and perhaps even expanded opportunities to pursue their artistic interests in the years ahead. Secondary world language is next, and first I would point out that all of our middle schools do offer at least Spanish 1 and French 1. So that's kind of the baseline, what's above the line for our secondary world language offerings. All of our high schools offer at least 3 languages. But you'll note, if you look at this in the report, that there's a range of offerings. Some high schools only offer 3, others offer up to 7. So again, there's a range in terms of those offerings by a particular school. You can again see that actually in this case, more high school students are taking language than middle school students are, but that again is largely driven by graduation requirements and college entrance requirements where students take that experience at the high school level. We still use our general education staffing formulas, and you can see that we have overall as a school division a large diversity of languages that we offer. There's 11 different languages that we offer in FCPS. If that's not the highest amount of languages in the country, it's certainly near the highest mark. We are utilizing, for some of our less commonly taught languages, our online campus, so that's been something in recent years that the board has supported additional funding to add in more language offerings to online campus, because if you attend a base school and you can't take a particular program, because there's not enough students in your school, being able to take that at the online campus is a more fiscally responsible and efficient way to offer some of these programs. World language immersion at the elementary school and the middle school is more of a specialized program, and it is more limited. You can see that we only have 17 elementary schools and 16 middle schools that offer immersion. The middle schools offer immersion because if the elementary students feed into the middle school, we want to make sure that those students have that same experience. But you can see it's a small number of students overall when you look at the number of students who participate in the program, about 2.5%. This has been and is a goal in our current division strategic plan to help all of our students become communicatively competent in 2 or more languages. But this is an area that we've really struggled to find the additional staffing and resources to expand. But for the students who participate in this program, it's an amazing learning opportunity. Students have the opportunity to learn in 2 languages, English and in that target language. And we have, again, diversity of languages offered in our immersion program, but most of our programs, the predominant language in our immersion programs is Spanish. At the elementary level, where students do not have the opportunity to participate in the immersion program, which is essentially a half-day experience in learning in a second language, we have a different program, which is our foreign language elementary school program / language through content, so FLES/LTC. And this program is offered in 55 of our elementary schools. You can see about 37% of our students have the opportunity to participate in this program. But it's a different program than Immersion with different program goals. The goal is not to develop that competence in the language. The goal is to expose students to the language and to expose students to the culture so that students would be perhaps more interested and inclined to pursue language at the middle school level. One of the reasons that we put this program in is it's a more cost-effective model, and it was more scalable than trying to get Immersion into all of our schools. Even though the board has had the goal of having Immersion experiences available in all of our elementary schools, this was a way to try to get some language exposure to more students more quickly. And it's a program that we've had in place for a number of years, again, with those goals going back 20 years, really, to 2001, when the FLES program was started. Certainly can talk about that program in a lot more detail. Next is our elementary magnet program. You see we have 3 elementary schools. We really have 2 because we have Bailey's Lower and Bailey's Upper, so we count those as 2 because the state counts them as 2. So we have Bailey's and then we have Hunter's Woods. These are magnet programs that we run a division-wide lottery for, and we do that centrally. And these schools do receive a little bit of supplemental budget and staffing to support the integration of arts and sciences and technology more broadly across the curriculum. These are great programs. They were started all the way back in the 90s. And I think probably at that time, I'm just contemplating, I obviously was not here at that time, probably there was a desire to expand those more broadly across the system, but we've really never been in a position to be able to do that, at least in the time that I've been here. And again, we can certainly talk about that in more detail as well. Next, the board asked to take a look at advanced placement and IB. So the first slide that you're looking at here is for our advanced placement program. This program was started in FCPS in 2001. We have 17 high schools that offer robust AP offerings. In the supplemental materials, again, you can look at every school, which courses they offer, what's the enrollment in those courses, and what are their demographics of the students who are enrolled in those courses. And again, when we look at that and we look at AP, we know that even though we've had open access to these programs, open enrollment, we know that we don't have the diversity that's represented in our overall student body. Just looking at other things maybe that are important to point out here, we do pay, of course, as a school system for students to take up to 6 AP courses, and you'll see that when we go to IB, of course, we do the same thing. So that's, again, something that we've done to really promote equity in the system and make sure that all of our students have the opportunity to test and have an opportunity, despite any financial struggles or challenges, to earn those college credits. Next is our IB program. We offer IB in 8 of our high schools. That represents about 33% of our high school students overall who participate in IB courses. Again, as I said, students, of course, can test free of charge in up to 6 subjects. The cost is larger, of course, in IB than it is in AP because we are required by the International Baccalaureate Organization to provide some staffing support for program coordination, professional development, and curriculum development for our IB classes. That drives up the cost, as well as ongoing professional development that's required for faculty. So a lot of those best practices in IB, which are required, do drive up those per student costs. And lastly, in the instructional program category, are our career and technical education programs. Obviously, I did not provide the same kind of overall summary slide on this one as we did for the others, and that's because we have a program review that the board approved that's currently underway, and we're in the process of collecting information. Again, this is an external program review that will be brought to the board in the spring, probably, of 2022, so this coming spring. And I won't read all of these to you, but these are the research questions that were included in the RFP that this study will answer. And I would just point out a few things. That one, we've asked the consultants to really look at issues of equity of access, because we know that's been an issue and a concern for the board, is what opportunities do we currently have, or barriers or limitations do we currently have to accessing certain programs that might be offered at some schools and not others when it relates to career and technical education. And then the other big issue is looking at what programs that we currently offer. Are they really in alignment with those workforce trends and needs? Are they really in alignment with best practice models in other school divisions around the country and national models of career and workforce development? So those are kind of the two big areas that this study is going to look at. And again, we'll have results probably this spring for the board to be able to review. And we'll certainly, as a staff, be responding to those recommendations that we receive in that review. So the next category are our instructional initiatives. And these, again, are related to our strategic plan goals, but largely things that are supported by grant funds or small amounts of department funds. So these are not things that we've budgeted or targeted for strategically in the overall FCPS operating budget. And the first program is Get to Green. And you'll see that we do offer Get to Green in 139 schools, which sounds like a lot, but when you look at the overall enrollment of the students who are really actively participating in these learning experiences, it's a small number and a small percentage of our students, because it's not every one of the students typically participating in that particular school. Largely, this program is run and supported by faculty members or volunteers in that school community, and provided limited opportunities for students to engage in environmental stewardship, environmental learning opportunities, all of which, of course, are very much in alignment with our goals around Portrait of a Graduate. But this is a program, again, that has largely been funded with grant funds and department funds and support. So we did, as you can see in the cost column, at the board's request, earlier this year provide kind of a cost estimate of what would it take to really scale this up and make these types of learning experiences more available to more of our students. And it is a significant amount of money. That's largely, which you see there at $2.1 million, that's largely to pay for additional staffing support at each of our schools to help coordinate this program and make it more available, as well as some central resource teachers to provide coaching, curriculum development, and work with the teachers and the students in all of our schools around the division. So again, we can talk about this one in a lot more detail as well. But again, a program that we all believe we would like to be able to expand, but there are financial barriers that would need to be addressed. Similarly is our elementary school STEAM and computer science program. So when you think about, all of our middle schools and high schools have computer science and STEAM course offerings. All of our elementary schools, we're not actually really sure, to be honest with you, still exactly the precise number of schools that offer that, because schools do it in different ways. So we're still looking at the data to try to have a better understanding of the different ways that schools offer some of these STEAM experiences. But we do know that in 2019, when we kind of did an apples to apples comparison, at that time we had 46 elementary schools that were offering STEAM in an intentional way, where it was kind of part of the elementary rotation. It's probably a little bit more than that, but not significantly more than 46. So that gives you kind of a rough idea of where we currently are, which of course is a long ways away from having all of our elementary schools at over 140 schools offer that. Again, some schools have done different things with staffing and trades and found different ways to staff that program. We are not building STEAM staffing into the elementary school staffing standards. So unless we were able to find a way to do that, we probably would continue to have this discrepancy with some schools being able to offer it in an intentional way and other schools doing it more through an integration with general classroom teacher support. So we can talk about that in a lot more detail as well. And then finally in this category is our Global Classroom Project, which is a great project. What it does is it pairs students in FCPS schools with students around the world in classrooms of similar age and experience, and they work together through project-based learning opportunities, largely designed around some of our global issues and challenges that organizations like the Organization for American States has identified, as well as other international organizations. So working on things like environmental education. You can certainly see the tie and the connection to Get to Green there. So a lot of these programs support each other and complement each other. What you'll notice, I think, most about this program is it's very small. It's not offered in many schools right now. There are a number of reasons for that that we can unpack. One of the reasons is just the challenge with developing those partnerships with schools around the world. That's not easy to do. It does take a lot of legwork to be able to do that. We recently initiated a partnership with the Organization for American States, who's helping us, and they've identified about up to 65 other schools and other classrooms where we could partner in the future, and now we just need to make those connections. But of course, in a time of COVID, this is not the most pressing priority for many of our schools, so it's going to take us a while probably to scale this up. But a great program for the students who participate. Another challenge is that many of these partner schools around the world, they need to have the technology that allows them to connect with our students. But when they have that and our students connect in live, real time and are partnering together, it's an amazing learning experience and complements many of our programs, including Get to Green and World Language Immersion, for example. So next is our last category, which are services and support programs. And these, again, are programs really designed to help our students, historically underrepresented students, be able to be competitive in the post-secondary education admissions process. And all of this really is situated under the umbrella of our College Success Program. This is a program really that dates back to the late 80s and the early 90s. Again, I think another amazing support program and resource program that we've had for a long time with a really strong history in FCPS. Strong partnerships in this program, both with Northern Virginia Community College and George Mason University. Again, partnering with those colleges and universities to provide students with mentorship, tutoring, support through the college admissions process, and support even with financial assistance for admissions once they're accepted into colleges and universities here in the state of Virginia. So you can see in the enrollment column the number and percent of students that participate in the College Partnership Program, our AVID program, which again is kind of a study skills support program, our Early Identification Program, and then Pathways, which is a specific program that we have under this umbrella. So we can talk about this in a lot more detail. Expanding many of these programs would require expansion not just for FCPS, but also expansion at the community college and university side. So that's one of the big nuggets really to understand here. And we have expanded AVID most recently because that's something we can do with our own local dollars. All right, so recommendations, and we're going to wrap up here and move into whatever is at the board's pleasure after this. So we are recommending that all the programs that we just talked about, we do believe serve a purpose, meet a number of the criteria that we talked about originally, and have constituencies that are very invested in these programs. So we are recommending the continuation of these programs, but we're also targeting 4 particular programs that we would recommend for the board to maybe consider for further analysis in phase 3. These are just recommendations. Certainly we will go in whatever direction the board would like us to go into, but these are our initial recommendations. So I want to unpack each of these in a little bit more detail, but you see dual language immersion. Oh, I'm sorry, thank you. You see dual language immersion, elementary STEAM, computer science, Get to Green, and career and technical education. So I want to unpack each of these in a little bit more detail. The first is around our immersion program. And there are different types of immersion programs that we offer in Fairfax. One is called a one-way immersion program, where all of the students in the school largely are native English speakers and are learning a new target language together. They might be native English speakers, some of them might be native Spanish speakers, but they're learning the same target language together, and they're novices in that target language. In a two-way immersion program, though, what you have is half of the school are native English speakers, or half of the classroom, I should say, are native English speakers, and half of the classroom are native speakers of that target language. So if you had half of the students who are native speakers of Spanish and half of the students who are native speakers of English, that allows you to support students in a lot of different ways. Particularly for students in schools where they're native Spanish speakers but are not yet proficient in English, a two-way immersion program has a really strong evidence base of promoting English language development, which is critically important, obviously, for us with such a large number and percentage of English language learners in our school system. And we have a lot of families who are very interested in multilingual, bilingual education and would love for their native English-speaking students to be able to also learn a second language. We have currently 26 schools where the population of the school, the demographics of the school, would allow us to essentially offer dual language immersion in largely a cost-neutral way. It's not entirely cost-neutral, but largely a cost-neutral way where we wouldn't have to hire a lot of additional teachers. So 26 schools, all of those schools are schools where that target language would be Spanish. We have a couple other schools that are close to the threshold in other languages like Arabic, but aren't quite there yet. So this is an opportunity that we think that we should explore and study it. We have shared this opportunity with the board in the past, and it's been challenging. There are certainly, a lot of opportunities, but there are challenges with trying to implement this type of programming. One, of course, is finding the qualified staff, because obviously you have to be a licensed teacher. You require that bilingual proficiency in both of those languages. That is challenging. Also, many of these schools have competing priorities. So in the past, a lot of schools have been working really hard around school accreditation and didn't feel that they were ready to take on implementing an additional program like Immersion. So there are opportunities here for sure, but there are also challenges. So we would recommend that this be one of the programs that we do some additional analysis around. Second would be looking at our STEAM and our computer science program. So obviously, this is a goal that's aligned to Portrait of a Graduate, making sure that students have those technology, engineering, math, as well as arts learning opportunities in science. It's aligned to Portrait of a Graduate. It's aligned to 21st century learning outcomes. It's aligned to workforce development. There's a lot of convergence with our criteria that we use to think about programming. We also, of course, have the VDOE requirements to implement computer science learning opportunities for our students into our practices. And it does complement, our STEAM program does complement a lot of our other specials programs. Obviously, the arts are named there, but you can think about the complement to Get to Green as well, and some of the science and environmental education that we would like to do. Challenges, though, exist here as well, of course. There's always additional costs with bringing things on and scaling them up, as well as additional staffing that we would need if we were going to build this into the triple T time and build it actually into our staffing standards. And if we do that, and this is for future conversation probably, but if you put more things in triple T, you can't really do that without taking something kind of out of triple T or reducing the amount of what's in triple T or reducing the amount of what's in your core instructional time or extending the school day. So there's challenges with adding more in. It's easier to add things in at the secondary level because students might choose to take one thing over another. But when you push more things into the elementary day, you can only push on that balloon so hard without something else popping out the other side. And that's always the challenge when we think about elementary programming. Next is Get to Green. And again, a lot of opportunities here for us in alignment with our criteria that we use around programming. Certainly, we would love to have more equitable access and universal access to learning opportunities that promote environmentalism, resource stewardship, and environmental stewardship. Certainly, alignment with our Portrait of a Graduate outcomes and attributes, particularly ethical and global citizenship. And we know that there's just a lot of benefits, and we've seen this really, I think, during the time of COVID to outdoor learning. There's a connection to nature and place-based learning, I think, that is calming for many of our students, promotes health and wellness and mindfulness. And the more of that we can do, I think the better student achievement is actually going to be in our other subjects. So there's a lot of benefits to our Get to Green initiative, but we still have some of those same challenges when we think about where does it go in the day and how do we develop the budget for it. So again, we had shared some initial budgetary costs for program expansion for Get to Green, and that's included in this presentation. And then finally, we really need to take a deep dive into the career and technical education program offerings. So I think we really need to try to prioritize some time in the spring or early summer to be able to bring back those recommendations from the outside consultant and really take a deep dive into that information and think about next steps. So this is kind of just a placeholder for the results of that study to come in. And then last slide is I've tried to race through this as best I could, thinking about our next steps. Ultimately, it doesn't have to happen today, but it does need to happen at some point. The board would need to reach consensus on which programs would we move forward for analysis into phase 3. And obviously, we would need some time to do that additional analysis and be able to provide that information back to the board. So I'm going to pause there and say thank you for your patience with that. I tried to go through it as quickly as I could, and we still have some time on the clock for some discussion today if you'd like to use the time for that.
All right, colleagues, we all have agreed we're going to end at 5. So there's 2 ways we can do this. Well, if we all agreed at that, know that not everybody may have a turn this time. Everybody's okay with that? Nod of heads because, okay, because, well, you can speak to it in a second. Well, see, now we got questions. See, because you know how this goes, people have detailed questions and detailed answers. So then the only other way we can do this is if people take long, if we only get 5 people in and then, you know, the other 5 will not get to speak today, we will speak at another time when Stella and Rachna will put something on the, you're shaking your shoulders. Okay. Okay. So I don't want to get into losing 15 minutes by this. So let's go forward and we'll see where we are. We're going to end at 5. Of course. You please do that. And we will end at 5. We will try to get as many people in as possible. And after that, we will need to do obviously a follow-up work session. I'm thinking. That's my thought right now. So I have right now Rachna, followed by Karen Corbett-Sanders. 2 minutes.
I'll go up.
Okay, thank you. I'm glad we are doing this because, as many of you have heard me repeatedly talk about the FCPS promise and the inconsistency of the promise delivered at each of our schools. So I do think that when you talk about where that bar goes on your elementary school in particular, we do have to have a detailed conversation, and I don't think we're going to have time today to get to that detailed conversation about where the bar is. But I will tell you, one of my biggest concerns is that the FCPS promise needs to focus on also the expectations of literacy in the math, sciences, and liberal arts areas. And from that standpoint, it leads me to your recommendations for the Get to Green and for the STEAM programs. And I think it's a little premature when we haven't even addressed the availability of a math resource teacher in each one of our elementary schools and the provision of the advanced math programming in each of them. Secondly, when we talk about Get to Green and STEAM programs as 2 separate recommendations, I think we are selling ourselves short because we have a limited number of resources. And should we be re-looking at that in saying that it is a STEAM program that includes Get to Green and literacy in our computer sciences area? And from that standpoint, those resources could be funneled through to have a science resource teacher at each school. And that would also ensure that we get the outside work, but we also have a science fair at each one of our elementary schools, because today we do not have science fairs at each of our schools, and so then our kids get to upper levels and they haven't had the same experiences. So that would be my advocacy.
Staff want to respond at all?
Well, I want to give as much time to board comments as possible. I would just say, I mean, I think those are great suggestions and definitely would warrant further discussion, but some, I think, interesting opportunities there. So thank you.
Ms. Sizemore-Heiser?
Thank you. And I want to first just thank my colleagues for taking the time to go till 5 to sort of let staff present and dig into this work and really start the conversation around our programming. So I appreciate that. I appreciate, Dr. Pacitti and your team sort of framing out what we have and sort of the analysis that you provided and then giving these recommendations. And I do think, it's important for me to sort of always remember that this is a program review on a non-core programming, right? And so we have many initiatives going on around our core programming as well. But, when we look at to me, when I look at sort of Portrait for a Graduate and I look at, what FCPS is and why I and many people moved to Fairfax County, it is for the strength of our academics and the breadth of our non-core programming, right? And so that students have opportunities for all of these things. And so what I like about your recommendations is that you're targeting things that are part of that breadth of non-core programming that people expect to see in the 21st century as part of being a Fairfax County graduate and the Portrait for a Graduate. So I think those are great. The only thing I would really talk about when you look at arts programming, and I'm always going to bring up arts programming to you, to really look at how intentionally we can look at embedding, measuring, and assessing our Portrait for a Graduate skills within our arts programming. I think sometimes when we look at arts, we still kind of look at arts programming as how it was designed, many decades ago. But really, they're very natural places for students to learn that teamwork, collaboration, problem solving, creative thinking, leadership, especially at the secondary level. But I think there's room even at this elementary level. And I know sometimes our core academic teachers struggle to embed Portrait Graduate on top of everything else we expect them to do. So looking at our non-core programming, I'll say arts, but probably in many areas, engineering, computer science, environmental science, to make those the primary places to assess the Portrait Graduate skills as opposed to core academics. That's my 2 cents.
No, I think that's great. And again, when the board reaches some consensus around what to include as part of phase 3, certainly arts could be part of that. Just very briefly, I would say, pre-COVID, we were working very much as you just kind of described to really think about the arts and our elective programs as a vehicle for Portrait for a Graduate and demonstrating that knowledge and those skills. And we have something called our Portrait of a Graduate Presentations of Learning, which fits excellent into the arts courses, for example, to really demonstrate through performances, through portfolios, not just the student content learning, but the skill development. But again, of course, with COVID, we've had to really slow that and roll that back. But definitely a huge opportunity as we start to come out of COVID for that.
Thank you. Next is Ms. Cohen, followed by Ms. McLaughlin.
I appreciate this, and I appreciate you taking the directive and trying to give us some direction on what are the areas. I think, my frustration is this is all wonderful, right? Every single one of these programs will have a room full of people dressed in one color or another to advocate why we should keep these. And each one of us has children who've participated in each of these. Or Abrar has participated in. And so, we're all advocates for different things. I guess, my big question, though, is when we look at this is what moves the needle toward the goal of closing these gaps? So if we look and we see that there are schools who have been really successful with independent time with the AARTs, no matter what your level has been, is that more important than time in FLES? Or is it more, we're asking you for valuative statements, which may or may not be fair, but you are more qualified to give those than we are, whose kids may or may not have had success in any of these programs. So I do feel like in figuring out collectively together what programs move forward for analysis, I think looking at that kind of information for us, I think would be so important, because there's not a one of us who wouldn't tell you that these are all very worthy endeavors. And growing up where many of us grew up, I mean, it's a lot of gravy. It's things, I never would have been exposed to and never was as a kid, and now my own children are. So they're all wonderful and amazing, but if we can't do them all well, how would you prioritize what we do and don't do?
Yeah, and I think that's a great question, and I would say that's really kind of phase 3, right, is getting into further analysis that could feed some recommendations like that. But also I would say that's got to be a collaborative process. Going back to that list of criteria, community interest, student interest, I think those 2 criterion are incredibly important. Obviously, staff need to be involved in that discussion. We can talk to you about recommendations, benefits and challenges, but there is some subjectivity around, what does a school community, a particular community, really value most, and what do they want to see in place? And so, I think that's kind of a back and forth a little bit with the board, is kind of, representing the community as well as other, community members being part of that conversation. But that would, I think, come out of phase 3.
Yeah, I just
those
think
types of recommendations.
to my colleagues, we all have to be careful of that, I think, because these are amazing. And I look at, if we just use student attendance and interest, we look at these CTE programs that can change kids' lives, but because they don't know about them, they don't know to. So this has to be a larger conversation, to the point, I guess, of everyone here today, that I wouldn't walk away today feeling like I knew how to advocate for what we get rid of and what we expand.
Yeah, and just to clarify, again, today is not about trying to make decisions, really for the community more than anybody. Today is not about trying to make decisions about what would we advocate to expand or maybe, scale back on. It's really about what programs do you want staff to take a deeper look at that would help further that conversation later this year. Yeah.
Ms. McLaughlin.
Thank you. Quickly, I guess, picking up on where Laura Jane was talking, if you're telling us that from your expertise, you would like to see us support all 4 recommendations, you think that that's the next best step. Otherwise, I'm just not really sure, from an operations standpoint, which one I'm supposed to greenlight. I will tell everybody that I think the recommendation 4 on CTE, workforce readiness, is probably one of the most important things we can do. I would like to know at the end of my time how much we're paying on this contract for 4-Point Education Partners. What's that going to cost, or what's the estimated cost? Do you guys have the bandwidth to do all 4 buckets on these recommendations? Because as we know today, unless we come back and do a second round here, which is why I think some of us have discomfort of leaving here today, and we are missing a couple colleagues. But I really want to focus on what Laura Jane said. There's our core mission, and then there's our bells and whistles. And I love the bells and whistles, and it brings a lot of families to Fairfax County, and that should be that we're a world-class school system. But we also know from the literacy presentation in a recent work session that FCPS has a long way to go to closing our achievement gaps and our opportunity gaps. And so when I look at this presentation and the breadth of what this is alone, I guess I would ask for you and Dr. Brabrand and the team to really let us know what's going to be our mission focus between now and when we onboard the person who's going to supersede Dr. Brabrand, because that person has got a steep learning curve. And I look at this, and I look at closing gaps, and I look at our focal point that Ms. Corbett-Sanders said, and that's what gives me pause with answering today, what do we do with the recommendations? Thank you.
No, I appreciate those comments. And, we do have a lot of things on our plate in the academics team, right? So, your question about, what can we do in terms of bringing back some additional analysis and recommendations, we are somewhat limited by time and resources to be able to do that. So we could bring something back, but the board is going to need to know that it's going to have to be an iterative conversation. Like if we bring something back, I mean, I'm good hearing about the things that, you know, we need to do beyond that report that we would bring back, but I would want to set realistic expectations about what that conversation would look like, because I don't think, for example, if you said, okay, we're going to vote and we're going to, you know, ask staff to go and take a look at these 4 recommendations, come back to us in March with something more, I don't think it would answer all of the board's questions, right? I don't think that would be the end of that conversation. But we could bring back some additional information to advance that conversation and further that conversation later this spring. I think we could do something like that if that's at the board's pleasure.
And the cost?
Jen might know that off the top of her head.
So I don't have the exact amount today, but it's between 60 and 80,000 currently with the scope we've assigned. And we are able to use some Perkins funding to support that cost. So we're in a really good position with this study.
All right, thank you, Ms. Tolan.
Thank you very much for putting all this together. It's a lot of information. I wanted to follow up with something Karen Corbett-Sanders was saying, and that I did see in, you know, the work that I did with Get to Green, is there's so much, and you brought it up several times through the presentation. There's so much opportunity for collaboration and overlap with STEAM, Get to Green, Global Classroom. You know, some of we've had a lot of conversations with CTE. They were a part of our JET team looking at green career development. So, you know, I've been wondering moving forward how we could really look at this from a sort of like a team view, you know, STEAM, the science team, our sustainability staff, because the Get to Green work too jives very much with our JET goals and what we're supposed to be doing with Fairfax County to achieve those goals. Our facilities and sustainability staff need to be engaged as well, just to coordinate all of it, not just have a separate, you know, budget for this and a separate budget for that, et cetera. All needs to be collaborated. So I don't know exactly where to go with that. You know, how do we? Looks like Noelle is maybe ready to say something.
Yes, and good afternoon, everyone. I think doing this study even elevated that, right? I mean, we've all been working on these things, and we could see these. Colleen Eddy is in the room. She's our new director for curriculum instruction. And when she saw this coming new to the job, she said, why do we have these 3 things? Why are we not doing all these? And how come literacy isn't like kind of, you know, literacy is not just about learning to read when you're in K2, right? Literacy is reading, writing, speaking, and thinking. And so all of these things really can work together to support our students.
Yeah, and I think if you looked at the like 139 schools that have Get to Green, for example, a lot of those schools have a science resource teacher or a STEAM resource teacher. So that's how that program is able to proceed. I did want to throw in, given the numbers with AP and IB, you know, AP, I was very pleasantly surprised to see 70% of our students are taking AP courses. And then I think it was like 30% with IB. Those are bigger numbers. I would really like to see a little bit more analysis about where we have these programs, where, and maybe even more where we don't have the programs.
Yeah, and in the supplemental documents, we have a lot of that, but we could probably run the numbers in a way that would be a little bit easier to interpret on that. You know, for example, we could run the numbers to show, you know, what is the percent of students at a particular school that are taking, you know, 2 or more classes, for example, or 4 or more classes, right? I mean, we could do some things like that to help with some additional analysis on that. Yeah. I do want to just reiterate your point about the importance of having a resource teacher to lead a lot of this innovative work in schools. I really worry a lot about our elementary teachers, and oftentimes what we've done in the past is we've said, well, we can integrate these things and teachers can integrate that into the content. And not only is that just incredibly difficult to do, it reduces the amount of time for that content learning too, but it's incredibly difficult to do, and not everybody's going to be able to do that. And certainly nobody can do it without additional planning time to be able to do it. So having a resource teacher available to support our classroom teachers with doing this work, I think is incredibly important. Even looking at central office staff, I mean, sometimes we say, oh, well, central office could develop those resources to do that. Well, we've got one elementary science resource teacher for the entire school division, right? I mean, that's not realistic, right? So we have to be realistic too about what our expectations are as we think about doing some of this integration work sometimes, which is where we fall back to.
Thank you. Ms. Marin.
Thank you. I've been looking forward to this since June, so thank you. And I have to say, I'm really pleased with the way that the information from June has been further distilled and presented, so thank you. I know how much you're doing, and I think it's really helpful, and I think I want to just reflect on a few things that have already been said. I agree with the comments earlier about that these are all wonderful things, but we don't have infinite time and budget. So I would hope in the next phase we can get to that really whittling down what is that FCPS promise. And I'm intrigued by that idea of, if it's the ART is the staff member that makes a difference, or an extra reading specialist in schools. I think we have got to unsilo these programs and get to the interdisciplinary and the integration of the content and the skills. I certainly want to give us permission to do that, and whether it's Get to Green or Global Classrooms. And again, this is something I know I've shared with you before, but what were the criteria for having the program? Some of these programs you mentioned were created in the 90s. Well, the world's really different now. We're much more connected. We have more global connections. So is that already happening? Does it need to be a little bit more intentional, or does it need to have that whole program? So I think, I'm really, really interested in this world language piece. So I would push you, please, to not only look at dual language immersion, but look at why half of our elementary schools have no world language experience. That is a huge equity issue. So I think those go hand in hand. If you're going to analyze a dual language immersion, then you've got to analyze the access to world language in elementary school. And so I know I've shared before, I just want to pull up here the questions about what are the criteria for a school to have a program, what it takes to actually obtain and implement it, and then to measure the impact and accountability. But again, if we can think about blending these experiences and content more, perhaps we get out of that silo of it's this program, it's this program. So thank you. I look forward to phase 3.
No, and thank you. And Ms. Marin, I think you were the first board member to contact me after we sent the information out in June. So I know you've been very interested in it, so we're happy to continue to engage with you and other board members offline too. So thank you.
Ms. Keys-Gamarra.
Thank you. I really do appreciate this report, and I want to kind of deal with this at the 30,000 level, as my friend Ms. McLaughlin always said. And really start with, and I hope I don't butcher, I heard Dr. Williams at the Equity Symposium, and she said that, this is my summary, so she said we can really transform education if we would only be bold. And I think that this is that kind of opportunity. I think we're off to a great start, but it really does start with that equity lens. And I'd like to look at this information through that lens with this board understanding what our definition is. I think we spend a lot of time just talking about what that means, just like we talk about spend time deciding whether we're going to have a meeting or keep going. But we need to have that clear definition, because this really isn't a zero-sum game. This is us trying to figure out, how do we move the needle for all of our students? We know that we have AAP, we know that we have IB, but we know that they're not equal in all schools. We know that all students don't have access to it, and we know that once we dig into those programs, we've got some demographic issues. So I would really like to see what you really need. Is it a staff issue? Because we need to talk about that, because we can't afford not to really dig in and do this for real in a transformative way. And I think that we're all sincere. I'm not questioning that at all. But I really think that I want those recommendations that are going to help us go across all of those lines, offer that, literacy infused, equity infused, really providing the level of support we need at the leadership level as well as in our schools. And we need to hear your honest opinion of what it's going to take to achieve that. My 2 minutes are up.
Yeah, I don't really have too many direct comments other than to say, I mean, I appreciate those questions. They raise a lot of additional questions, I think, for us as a, for you as a board and for us as a staff leadership team working with the board to really figure out how we define success and what priorities we want to identify for improvement in the system. I mean, I think those are two of the big pieces that would have to really be answered first for us to be able to move forward and answer some of your additional questions about what are we going to do differently and what's it going to take to get us where we need to go. So I know the board's wanted to have some of that discussion for quite some time. Dr. Williams coming on to our leadership team has really helped us put an equity lens on some of that, but I know the board's having conversations in board retreats about some of it. So I think we can get there, but there's more conversations, I think, to be had.
Can you tell us what information you need from us today? I didn't see anybody else's hand up, so is that okay if I ask this question?
So what I did in today's presentation is really probably narrower than I think what you're asking, which again is a great series of questions. But the board had approved this program review with 3 phases. So phase 1 was collect the data in June, share the data. Phase 2, talk about it today in a work session. Phase 3 was from the things that we talked about today that are in this program review, what additional analysis do we need to do that would help the board think about program opportunities for program expansion to address some of the equity of access issues with the existing programs, right? Like you're asking something that is bolder and is bigger. So I didn't really prepare the presentation really to get at what you're asking. I did it very intentionally aligned to what was in the board request for information for phase 3. So I gave kind of 4 recommendations of programs where I think perhaps there's some opportunities to address some of the equity of access issues that would warrant further analysis to help with some of the questions I think down the road that you're raising. So at some point, we need to figure out how does the board want us to move forward. And there's four programs recommended right now that we could do further analysis on that might help further that discussion that the board needs to continue to be involved in. You could choose to vote, if you will, or come to consensus to move those 4 programs forward for additional analysis today, or you could choose to wait and continue to have more discussion and come back to staff at a later time to give us direction at that point.
Thank you. I have Ms. Pekarsky followed by Ms. Omesh.
Okay, thank you. Number one, for me, it was very useful to see the information like this. I mean, because it is so overwhelming with the number of programs we have, the number of schools. So I'm very thankful that we have gotten to this point. I think because it allows us to do what Ms. Keys-Gamarra is getting to, which I think is what we're hearing from everybody is our ultimate goal, and how we kind of propel kids to go forward. And even just looking at the data for my own schools, right away, I'm able to make those comparisons and to see, wow, here, there are some stark differences in some places when we talk about access, when we talk about participation. And I think what you did helps inform the next step, which is what we're talking about. So I think where Ms. Keys-Gamarra, everything that she so eloquently laid out for us is really where I'm looking to go to. Looking at all of this, where do you think our gaps are? What do we need to do to fill those gaps? And do you think that the programs we have right now are what we should have? I mean, ultimately, I will say there are some that I question just from own experiences, things I have heard, and I think really getting down to that, what do we have that is going to prepare kids for the next steps versus what's nice? There's always a balance because that's why we're Fairfax, right? That's why people come here, because we're able to offer these great things. but really for that analysis piece. And I do think it is a partnership with a community, with us and with you, but I definitely think that you, Dr. Sloan, and your team lead that when you come back to us next time. So, thank you.
No, I appreciate that, and I would say, within the scope of what we looked at, not just B, but our team's best thinking really are those 4 recommendations when it comes to the issue, right, of where do we see differences across, the biggest differences across the system. Career and technical education is going to be one of the biggest ones, right? And so we've got that review coming in the spring. And then elementary, looking at the elementary STEAM and Get to Green are 2 other big areas, again, with some great comments and suggestions today about how to overcome some of those gaps and barriers. We didn't look at that yet. We were just identifying gaps, right? And then opportunity to be in alignment with one of the board's current strategic goals around world language continues to be that opportunity in dual language immersion. So those were the top 4 that our team identified for further analysis that hopefully could continue to support the board towards, maybe redefining some of the priorities.
Ramesh.
Thank you. Echoing a lot of the gratitude. This is tremendous. It's a massive, amount of work and information. So thank you for getting us started here. I'm actually very happy to follow Ms. Marin, Ms. Kizgamara, and Ms. Pekarsky. I think as I'm trying to unpack why I'm so anxious in this conversation, I think it's this concern around the fairness. How are we going to do this in a way that truly reflects where the needs are most dire, not just, where the loudest voices are, and then calculating urgency to each program, depending on its impact on children, and then also, the difference it makes in their learning trajectory. So I do support the recommendations. I think it's good to move forward. I actually was going to share the exact point Ms. Marin did about the language piece. I think expanding that a little bit to include the secondary world languages in addition to the immersion as an investigation may prove fruitful. And I say that, again, thinking about this equity piece, language is such a delicate thing to get right because, for some it's a nice to have, they add it and it's great, and probably by the time they get to college they forget it anyway. And then, for others it's about survival, it's about access to community, it's about preservation of heritage and culture. And I don't know that we've quite done the job to reflect that for our communities. So I would suggest that we expand that language component a little bit further. And then I think the point, remains that how are we cultivating young minds that are globally oriented, that are prepared for our world? Get to Green is a component in that. I guess with global classrooms, if we're going to leave that behind or not address it, perhaps, moving forward, thinking about what alternatives will manifest that, because we all know the direction, we're in a global world. Our community certainly reflects that. How do we ensure we're preparing kids to face that and to interact within that? So those questions still remain probably for the longer term conversation, but in the short term, that language piece would be my advocacy. Thank you.
Thank you. Did you want to speak to her comments?
Well, maybe I would just say, I think the comments about the purposes for language is really important. We have really worked, at least over the last probably, I guess I would say 5 to 7 years, to really think about the role of language in preserving kind of culture and community. As we've expanded some of our program offerings into languages like Vietnamese, we have a Korean immersion program, we've implemented Arabic in a number of places. It's all been because of that idea that we want to respect the heritage language speakers, and we want to be able to preserve the culture in the community. So that has been one of our overarching goals. We haven't moved as fast as many of us would like, but I appreciate you raising that up because those are really important goals to think about with language study.
All right, thank you. I'm going to take my turn, and then I have a few people for go-backs. Well, first of all, thank you both. I do appreciate all that you've done on this program review. I have 3 specific questions, and then I have a comment, so I'm going to be kind of quick. The first one, on pages 18 and 19, between AP and IB, is this an apples to apples? Because you have, for 18, at least one students enrolled taking at least one course, and then you have the second page, 19,000+ students enrolled. Is that just diploma, or is that students at least taking one IB course?
My recollection is that students taking at least one IB course.
Okay,
Yep.
thank you. My second.
Diploma program course, though, excuse me for a second. I believe it's just grades 11 and 12.
Yes, that's all.
Diploma program courses, yeah.
So diploma program courses, but not towards the diploma, or towards the diploma?
Well, we're trying to do an apples-to-apples comparison to your point, right? So since AP and IB are such different programs, right? The diploma program is just for, generally, right? Just for grades 11 and 12.
Correct.
Right? So comparing those diploma program courses to those AP level courses. Many students take AP level courses earlier than their junior year, which allows for some of those numbers to be a little bit more inflated on the AP side. So there's no perfect apples-to-apples comparison, but that's what we're trying to do there.
Okay, because, yeah, I just wanted it to make sure it wasn't just kids pursuing the diploma only.
No, yeah, we don't count just diploma program students. Yeah.
Okay, thank you. My second question is, when you talked about triple T time, can you refresh us again what is in triple T and what would you take out if you added something as suggested?
Well, unless Noelle decides she doesn't want to do this, I'm going to let her speak about triple T because has more expertise on the calculations of triple T than I do. I would say, on your second question, though, I wouldn't feel comfortable speaking to taking something out of triple T. I think that would be kind of phase 3 of the board's discussion with the program review. But in terms of understanding triple T and how it's set up, do you want to speak to that a little bit more?
Sure. So triple T, just for information, stands for time to teach. That's what it stands for. But basically, the triple T time at every school is made up of your PE, your music, and your art, right? So those are the 3 things that are core across all schools. And then the amount of triple T staffing you get is based on the enrollment in your school. Those triple T, that time that students spend in triple T creates the teacher planning time for our classroom teachers, right? So that proportion is there. Other classroom planning time is made up from our SBITs, our ARTs, our librarians, giving time to the master schedule.
Thank you for that. And Sloan, I wasn't asking you or trying to put you on the spot, but the reality is triple T time is full up right now. And if we're adding to the elementary program, it's like, just the question is, if we do this, what can't we do? And that's a lot of what we're talking about today.
No, and I appreciate you saying that. I was trying to get at that a little bit earlier on the slides. I think I went through it too quickly. No, you're absolutely right. It's like that balloon is triple T, and you push on one side and the problem pops out the other side, right? I mean, you have a limited amount of time there unless you expand the amount of time in triple T and put more staffing in to put more programming in. The negative of that, beyond cost, of course, is then you have less time for your your core subjects that you're instructing in. So there's trade-offs in all of this. But yeah, the way that things are set up with that triple T formula, if you hold everything else, to a constant, you would have to take something out if you put something else new in. You're right.
Right, thank you. And then a question, is the Bailey's magnet curriculum considered STEAM?
I would not say so. It's more around the arts. They have their extra position. They have a dance integration teacher is where they use. So I would not say it's a STEAM program.
And I guess I will just, as far as my comments, I think a lot of what we're talking about here is basics versus the core mission in each of these categories. And as several of my colleagues stated, there are some things that are not currently in the core mission in all of our school. Robust science, advanced math, and then you talk about immersion and FLES. That's not the core, but we've been asking for these for years. We haven't been able to do it. So I'm also wondering where does something like Young Scholars fit as to enhancing that programmatic or formalizing that? We talked about that. And then also about scaffolding AAP curriculum in all elementary schools. And I will say out loud, still maintaining the center approach and the higher level approach. But we've talked about those kinds of things for years. And that's why at this point, I feel like some of these questions have to be answered before we can move forward, seeing how much whipped cream we need before we make sure the sundae is solid down there. So I must be hungry, that's why it came to my, I don't know why that analysis came to my head. but-
I like solid
Well,
Sundays.
I think we're all ready for some ice cream here in just a minute, so I like that. But yeah, that's what we were attempting to do a little bit with that above the line, below the line graphic, and really thinking about what are those things that we want to make sure are consistent and part of our core mission, right, and delivered consistently in all of our schools. And then what are the things that are below the line that could be additional services that might be provided in certain places based on a variety of factors, right? So where you draw that line, I think, is really what we were trying to get at. And I think you're raising similar questions to other board members like Ms. Keys-Gamarra a little bit, and broadening out some of those equity and access and achievement issues even broader than what we initially looked at in this program review. So I appreciate that.
All right, colleagues, we have 20 minutes. We can do 1-minute go-backs for anybody who wants it. Thank you, and I will start back at the top, like with Ms. Keys-Gamarra and Ms. Sizemore-Heiser. I did.
I'm flattered, thank you. So I would advocate that today is not a day that we give you direction to proceed with one of 4 buckets, because I think what we really need is a fuller discussion about how at least 2 of the buckets actually are in overlap and contribute to some of the core mission, as well as more along the lines of enrichment enhancement. So I would prefer, I also note that there are 25% of this board is not here as we are sitting here. So I would suggest that it's great for us to have this conversation, but I would ask respectfully of the chair and the vice chair to put this on another agenda. And frankly, this is the type of work we should be doing in the form of a retreat, because it allows us to unpack and have these conversations about how there's integration between the different programs and overlap. Thank you.
Ms. Sizemore-Heiser?
Thank you, and I appreciate what Ms. Corbett-Sanders said. I'm wondering, I'm torn, I will just put that out there. I agree with what you're saying, that we need a fuller discussion, but I'm also wondering, given what our calendars are, whether there's space to allow staff to look at the full recommendations, which includes a CT report, and bring us back sort of an interim, maybe in the early spring, so we can have a conversation, say, yeah, this sounds good, here's some more direction, right? So it's not a one and done deal, but it's also not trying to halt the work until we get back, until we can, so we don't feel rushed to try to do this in the next month, is all I'm trying to say, right? So I'm wondering if there's some space in there to say, these 4 recommendations, we get it, you've heard our feedback about how does this sort of, how can they be more interdisciplinary, how can we have an equity lens focus on this? Let's do a deeper dive into some of these programs. As you're doing this dive, come back and give us an interim, maybe report, and I will look to you for your your thoughts too, but I just would put that out to my colleagues, and then we can give further direction as part of phase 3, just a suggestion.
Thank you. Ms. McLaughlin? Wait 1 second. Dr. Brabrand, you're looking like you want to speak.
I'll wait a little bit longer.
Okay. Ms. McLaughlin, followed by Ms. Keys-Gamarra.
So I'm where Ms. Corbett-Sanders is. We're missing 3 of our colleagues, so that's 25% of the board. We've had just a few minutes apiece to speak, and I feel like I need to hear more from all of you all before I'd even have an informed direction. But I can't reiterate enough that until we close achievement gaps, and this is, it's achievement gaps and it's preparing kids for college and workforce opportunities. We do that, and then how some of this layers in, and many people know I've been a massive advocate for, 8 or more years now on mindfulness. And so how Get to Green becomes an integration of also healthy minds, healthy bodies, all of that. But I just feel like not right now at 4:45 would I want to green light all 4 buckets. So, but I think, the timeline said fall, winter. Winter runs until February. So I mean, the bottom line is I think we can get this and not hold up staff too much.
Thank you. Ms. Keys-Gamarra?
Yeah, just to continue, because I had just 2 minutes. Moving forward, I'd like to see data to support the recommendations to the, and wasn't able to dig in everything you gave me. I did the best I could. But I think that as we move forward with the board and to help assist with our decisions, that data would be helpful. With respect to, I know we talked about a number of our programs, IB, AP, et cetera. You know, I'm very interested in not only the demographic numbers, but also how it's different in different regions and what that means and what those outcomes are and how that correlates with those gaps that we've talked about. And that's some of the data that I'm mentioning. There's also programs where we specifically say we are reaching out to marginalized kids, such as the college success programs, but that's also a program where there's some of the least investment. So, you know, is that part of, I didn't really see, well, there is a recommendation here, but, you know, how are we going to fix that? Are we doing it through something else? Is it, it seems like there's an opportunity. Is my time up? Okay.
Ms. Marin?
Yeah, I'm not ready to agree on the recommendations just yet, but I think that what slide 7 is, the above the line and below the line, that's what we need more time with. And whether we do it at a work session or a retreat, whatever we want to call that meeting, that's the thing that we need to wrestle with you all. And I think that could we also have, like, in the intermittent times, like regional conversations? Could we have 2x2s with our regions to further dig down into that data? I think this also, you know, this intersects with the discussions on planning time. It intersects with the budget timing. You know, what I want to know is what is producing the return on investment and how can that return be identified? Like, do we have to compare it to those non-core programs in order to see what's really moving the needle? And I want to understand how the programs are offering like the funding. I know some principals, they trade FTEs and all of a sudden they have an outdoor learning educator like at Centerville Elementary, whereas at Wolf Trap Elementary, it's for a STEM educator. How can we find that data, understand what kind of funding decisions are promoting these programs? And I do want to say I'm really eager to hear what our Chief Equity Officer has to say about this work and approaching this with that equity lens. Thank you.
Ms. Pekarsky? Okay. Yeah, well, it's you and Elaine and then, okay, Elaine.
All right, so my head is spinning right now with all of the different ideas. I mean, we purposely didn't look at core programs, you know, when we looked at this as a forum topic. So that's why you're not seeing it in the analysis of social studies or whatever. But it's interesting to me that STEAM, Get Your Green, and even Global Classroom, they all tie very well into science. So I think it would be interesting maybe to think about, maybe we don't do a separate bucket for each of these 4 items. Maybe we somehow talk about how we could be creative in looking at it in conjunction even with science and science literacy, and how these different areas could collaborate to help with that. You know, which I think we take some further discussion and maybe another slightly different presentation to the board on how to move forward. And your reaction to that?
Well, I don't know what that other presentation would look like, but I do think a conversation with the board would be great, right? And I mean, I think the comments you just made, Ms. Corbett-Sanders had some similar comments, as did other board members. So that additional dialogue, I think, would be great, because ultimately, right, that list of criteria that we laid out, a lot of what we're trying to do is, what are the community's values and interests that you know, you all were elected to represent, right? And there's other ways for us to get more feedback from community members. But your voice in that is very important as we make some of those strategic priorities and identify what those are. Having this conversation around, you know, do we elevate the role of, you know, science education at the elementary level as a vehicle for some of these other programs, I think would be a great conversation to engage in further.
I mean, I think that's even an interesting community conversation, given the the large number of technology industry that we have here. I'm sorry, my time's up, I know. But anyway, that, stakeholder input.
Thank you. Ms. Amish.
Yeah, thank you. Just connecting the dots made me realize, language and literature too could be an area, and there's so much potential for that. I guess I would suggest maybe if we move forward, but do like 2x2s or something with staff so that we can give them some of our, more specified input as to our concerns and anxieties around the conversation today, but give them a preliminary green light at least to move forward. I think it's going to be unrealistic, colleagues, to think about how we're going to prioritize all of this, go through all this information in a timeline that makes sense, given everything else. And again, we're doing something different than deciding on the final addition or cutback on programs, right? We're just trying to see where things are already broken, where we know that there are some challenges and there's great potential, and we want to invest some time into that by the time the new superintendent comes in to have that broader conversation. So I just want to make sure we're clear on what's happening here. And Dr. Presidio, go ahead.
Well, was yours the last comment, or were there other board members still to comment?
There's others. And Ms.
I'll save my comment then.
Do you want to speak before I do?
Yeah, I'll speak. Wait.
Yeah, this is your 1 minute.
Sorry, I was having a side conversation. It was on topic, though. Yeah, I mean, I guess I'm trying to kind of parcel out like where we are right now, what our goal as a collective is, based on, first of all, was to get the data, to look at the data. That for me is huge. So that's a huge piece of this. I think the next part was to look at maybe some areas where, as you said, maybe we could do a little bit more digging, a little bit more thinking on. I'm fine with giving the green light to go ahead if you have the capacity, if you think we should do this. I think that's part of the analysis. I don't know that others are there. I don't see any reason not to get more information on some of these, as we then go on to have more in-depth conversations. So that's where I am, but I see people are not there, so that's just me.
You want to speak, Dr. Brabrand?
I want to make one comment, and Dr. Presidio maybe gets the final word. First of all, look what this team did.
Yeah.
This,
Amazing.
we haven't done anything like this in FCPS ever, and we did it in a pandemic. So Dr. Presidio, Ms. Klemenko, it's unbelievable work.
Yeah.
I hear a strong equity theme, though, across all this. The more that we can show that some of these programs are correlated with closing gaps for kids in schools in both core programs and perhaps also on our Portrait of a Graduate outcomes, if we can synthesize that, I even feel like this board could come together more. Is it going to be through elevating the science instruction and being able to put some of those streams in there better? So I've heard what you said. The CTE analysis that's coming in the spring, all of you agreed on that as a game changer, and I absolutely believe it is. It has been uneven across the system. We froze staffing for a decade. It has to be revisited intentionally. And I do think the next superintendent, one of the areas of focus is going to have to be robust, a renewed vision for CTE, because that is going to be the workforce for the future. And we have our ideas rooted in CTE from a long time ago, and it's got to get a freshen up, and it's about to. So I think we have some feedback from you all for phase 3. We have to balance the workload here, but to synthesize, how can we take some of this data analysis a little bit even deeper and get the strong correlation between where we see gaps closing for kids and in schools and the existence of these programs. So those are some thoughts that I have, and I think we can work with the chair and vice chair and figure out, and bring Dr. Presidio in to help figure out when the next time we could all convene, whether it's late winter, as Ms. McLaughlin said, or, we can figure that out. Dr. Presidio?
Well, thank you, Dr. Brabrand, and thank you first for recognizing all the work, and everybody for recognizing all the work that the team did on it, because it is a ton of work, so we really, really appreciate that. I guess I don't want to throw a curveball here at the end, but if I'm being honest, I would say unless there's really consensus from the board that these are the 4 areas that are going to be helpful to look at, I don't personally believe that's a great use of staff time to provide more information, do more work if it's not really meeting, the needs of the full board. So personally, we're happy to do the work, but if we do it, we want to make sure that the board supports it. Otherwise, it might be a little more prudent to give it a little bit more time, allow the board to have some internal discussions with each other. Maybe we could re-engage at some point in a discussion and get direction with the consensus of the board about the pieces of information that you want more feedback on. That's what I would offer. Certainly these 4 recommendations I think are great areas for us to pursue. So if there is consensus around those today, we're happy to do that. But I do think it would be helpful to have board consensus before we start working and producing more work.
Thank you, Dr. Brabrand and Dr. Presidio. I appreciate that. This is my 1-minute time now. I didn't take mine. So I don't think there is board consensus. You can hear it. We're pretty split. So I would appreciate more time for us to, take the bigger picture, look at the concerns that those of us had. And I understand this was never about the core curriculum, but with such big gaps in the core curriculum in some places, I feel before I go back to my Sunday, need a solid base before you add the wonderful things that make Fairfax Fairfax. And then we can come to some agreement on those. So if there is no objection to that, to allowing further analysis and moving forward at another time, working with Dr. Presidio, Dr. Brabrand, the chair and vice chair, to come back to us, and then allow us also to have conversations amongst ourselves. Dr. Ivy, you have a comment.
I was just going to suggest, and I think it was mentioned earlier, as a part of that further analysis and reflection on the information, perhaps the board we could set up some meetings with the region staff. And, as you go over the data and looking, at your specific schools and districts, perhaps that could be helpful. And we could also see if Dr. Williams was available to be a part of that as well.
I love that idea. I love that idea, and I see Dr. Presidio shaking his head. I think that's extremely important because even though I have regular meetings with my regional person, I don't have the data on all of these questions.
Because there's so much information there.
Because that's just part of it, right? That's just, So, Ms. McLaughlin, quickly, because I think we're ready to wrap up.
I guess my question to what Dr. Ivy said, I think Ms. Amish was actually more on track. We need central office and IS department that did this work. I love my regional assistant superintendents, but their focus is on managing and supervising the schools, not telling me the, achievement gap, educational best practice on how this program does this and that, program does that. So I'm trying to be mindful of everybody's time. And I guess I'd say, Dr. Presidio, if you can weigh in, who do you think is going to help us dig a little deeper into your narrative report and feel in a better place to give you direction to say, go forth and invest more time in these 4 areas?
Yeah, no, that's a great question. I appreciate you raising it. I think what Dr. Ivy was really saying is we could do that as a leadership team together, right? So you have the department staff from IS, from Dr. Williams' equity team, and the region to really do understand some of the, school-based ground level decisions that are being made about programs. All of us together maybe would be the best way to do that.
My only fear is there's 12 of us, so even if we went into teams of 2, it's going to be 6 hours minimum of time. If it's one person, yeah. So I'm just thinking out loud about all of the staff. I would almost say minimize the number of staff. They can come in, take notes, and go back to the bigger team. But I wouldn't have more than 2 of your people, Dr. Brabrand, because that's a lot of staff time.
Yeah, we'll definitely have to figure it out, but we're committed to doing it. And I do think the 2x2, getting a little bit more detail from the board, and then we can go forward and accelerate from this good first presentation.
Thank you, Ms. McLaughlin, and thank you all again for your excellent time and energy that you put into this. Much, much appreciated. Thank you so much. And thank you, board members, for getting us out of here and being mindful. And we made our 5 o'clock deadline, so thank you all.